Can I begin by welcoming you to the first hearing of the Committee's inquiry into foundational and disability supports available for children and young people in New South Wales. I acknowledge the Gadigal people of the Eora Nation, the traditional custodians on the lands on which we meet today, and pay my respects to elders past and present, and also acknowledge and pay my respects to any Aboriginal and Torres Strait Islanders people joining us today. I'm Natasha McLaren-Jones and I'm the Chair of the Committee. I'd like us to ask everyone in the room if they could please turn their phones to silent. And also a reminder that parliamentary privilege applies to witnesses in relation to evidence that they will give today. However, it does not apply to what witnesses say outside the hearing, and I urge witnesses to be careful about making comments to the media or to others after completing their evidence. In addition, the Legislative Council has adopted rules to provide procedural fairness for inquiry participants, and I encourage committee members and witnesses to be mindful of those procedures. First of all, can I thank both our witnesses here today for giving up your time and also for making submission. Could I actually start with asking you to state your name and your position and either swear an oath or take the affirmation? I understand the words which are in front of you. And I might start with Ms. Fitzpatrick.
Morgan Fitzpatrick, CEO of Corona Child and Family Services and Vice Chair of NDS's New South Wales State Committee. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Ms. Fitzpatrick, it might help if you just bring your microphone a little bit closer, and that way you'll be heard by everybody.
Yep. Is that better now?
Yep. That is much better.
Beautiful. Thank you.
Hi, my name's Alice Lands. I'm the... Sorry, is that okay? Can you hear me?
Yes, that's fine.
Feel free to slide it forward as well if you like.
Okay. My name's Alice Lands. I'm the CEO of Noah's Inclusion Services, Early Intervention Service on the South Coast, and also on the State Committee of NDS. Oh, sorry. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thank you very much. Would you like to start by making an opening statement?
We have prepared one, if that's okay.
That'd be great. Thank you.
Wonderful. So, as I mentioned before, I'm Morgan Fitzpatrick. I'd like to acknowledge the traditional owners on the land in which we're meeting as well and pay respects to elders past and present and anyone here with us today. To the Chair and Committee, we'd like to thank you for the opportunity to appear today for the Committee. We are joining on behalf of National Disability Services. I'm the Vice Chair of the New South Wales State Committee. NDS is Australia's peak body for disability services. We provide services, we've got several thousand members nationally, and in New South Wales over 300 services, 50 of which are children's services in New South Wales. NDS, as a peak body, has obviously prepared a submission which we're happy to speak to today. Just in terms of my role personally, I'm also the CEO of Corona Child and Family Services. We provide early childhood intervention, early childhood education, including community preschools that are inclusive, as well as supported playgroups, parent training supports, and other community supports. We also provide professional training and consultancy for capacity building around inclusion. I have several other roles that I think it's just important to put on record. I also co-chair the Child and Family Supports Alliance, CAFSA, New South Wales, which you'll be hearing from later today, and also the Early Childhood Intervention Best Practice Network, which you'll also be hearing from today. In addition to that, I'm the co-chair of ACAFSA, which is a national body in Child and Family Services, and I'm on the NDS Children's Expert Advisory Group. In terms of NDS's opening statement, we'll just reiterate what's in the paper, and I know we'll talk more about that today. The four kind of key takeaways we'd like to highlight. One is just around co-design of the foundational support system, making sure that it's integrated, it enables collaboration between providers, and it's equitable across the state, as well as ensuring that it's accessible for diverse needs. We also want to urge the committee in terms of its recommendations to ensure that the future foundational support system is aligned to best practice principles for early childhood intervention. That includes ensuring it's family-centered, strengths-based, and uses key worker and transdisciplinary practice. Best practice principles focus on a less is more approach, and I would add to that a quality less is more. So if we're doing really good quality services, we don't need as much. And that's about targeting that appropriately through best practice principles. The third point is the ecosystem is broad and multifaceted, and that's not going to change. We will always have health systems, education systems, community systems, Commonwealth systems like the NDIS. But I think we want to strive for a system where the family journey is seamless, They don't need to know the back end. They just need to know that they have support when and where they need it. To that point, we want to make sure that families aren't falling through the gaps, especially early in their journey, as they're preparing to have a child and soon after. There's been an inquiry just in November, that held hearings around early childhood development checks, and I think that there's a lot of findings from that would be relevant for this inquiry to look at. Another point is that they need timely advice. Right now, the current systems and services available don't provide that for families. We also want to ensure that children can access the support they need in the environments where they live, learn, and play. So the natural environments, the everyday settings that they live, learn, and play. So that's their early learning centers, their schools, their homes, and that's really critical for best practice to be achieved. And lastly, we want to make sure that we use existing services. We have a huge infrastructure here in New South Wales. New South Wales is actually incredibly blessed compared to other states in terms of the infrastructure we have within the community that's not necessarily being taken up and taken advantage of now. So we would urge the committee to consider using the existing community-based providers that are out there for ECI. And last but not least, we must invest in the workforce in order to achieve this. So attraction of the workforce, both incentives and a strategy to do that. Ensuring that core staff such as teachers, early childhood teachers are very critical to early childhood intervention, but they're not necessarily recognized in that space when we think about it through a health lens. But they play a very critical role across all domains of development, and that's their training. Also, allied health as well needs to be attracted to the pediatric space. Training and qualifications in best practice guidelines is critical to ensure that the quality, less is more, that I talked about can be achieved. If we're delivering best practice, there needs to be qualification around that to ensure that that is done appropriately. I think on that I'll end and just hand to Alice to give any opening statements she has. Thank you.
Thank you.
Thanks, Morgan. Yes, so I'm the CEO of a not-for-profit organisation, Noah's Inclusion Services, which provides a wide range of services across the South Coast, from Wollongong to Narooma, and funded through a range of state and federal funding, as well as NDIS. We support children through various forms of playgroups, early childhood education and care service, disability services, family support services, behaviour support services, and a whole range of other things. So, as Morgan said, also on the State Committee of NDS and representing NDS and the members and supporting the submission that they've made today. I think that really, as Morgan said, those key points for us are that we want to look at what the infrastructure is that is currently out there, but that some of the goals of foundational supports we believe should be focused on things such as workforce best practice, and integrating and working with health and education and getting that really strong ecosystem for children and families. I think that we know that there are multifaceted systems, and a system change is hard. NDS members are very experienced and good at adapting and being resilient through change. We've had a lot of change in different parts of the sectors that we work in, but we just believe that this is a really robust and brave opportunity for New South Wales to bring together a lot of very strong service providers and the community, and work with those frameworks to build and fund appropriately what is there for children and families, as Morgan said, so that they don't fall through the gaps. And understanding that families just want to, if they have a concern with their child from any age, those young ages, that they can say, where do I need to go, what can I do, and that they will not be given a different answer depending on where they live and who they ask, because at the moment that's a lot of what happens. There's not a lot of consistency, and we feel like families should not have to be worrying about that or feeling like, I don't know where to go and I keep getting told different things and I try and then I wait and I wait and I wait and I'm not sure which door is open to me. So we think that is really the crux of what we're trying to bring together in these discussions.
Thank you very much. Just so you know, the committee's resolved that we're going to have what they call a sort of free-flowing questioning, so rather than structured time allocated to members. But I might kick off and then hand over to my colleagues. But first of all, I want to thank you and also your organisations for the work that you do to support families and young people in New South Wales. And on behalf of the committee, thank you very much. I might start with, I suppose, your opening remarks that both of you raised in relation to the current community structures. And if you could, I suppose, highlight how some of those organisations are working well, and what we can learn in looking at how services can be delivered.
Yeah. Do you like to answer? You want me to?
Don't mind. You go first if you like.
Listen, I think in terms of existing community infrastructure, there is a broad suite out there, and that is everything from kind of those soft touch entry points for children and families, such as supported playgroups that exist in most communities. And I think an important distinction there, supported playgroups are often, they're staffed. They've got educational staff or allied health staff or professionals that have experience in early childhood, and they're in a position to provide early developmental advice to families if they're accessing that. And they're designed to be accessible to families and tailored to the local communities. They then integrate with a variety of other services in the area through interagencies, and there's strong interagencies throughout most LGAs in New South Wales. Through that, many of our providers and many of our members are also providing early childhood intervention. So there's a very strong, as I mentioned before, strong network of early childhood intervention providers providing that disability end of support. Now they will integrate in with your supported playgroups to ensure that there's allied health staff coming out, community health will integrate in with the supported playgroups, they're often a hub. And the aim is to ensure that when concerns arise, that those families get directed to where supports might be if they need a more intensive support. That works really well, and there's a lot of organizations now that, because there's not funding for early developmental concerns, unless there's a diagnosis or something that would, developmental delay, that would make a family eligible for the NDIS, if a family is not eligible for the NDIS, there's often a gap. So they can then be directed back to their GP, to a pediatrician, to community health, but often sit on long wait list. And that gets worse depending on the regions that you live in. And so often what will happen now is the early childhood intervention providers in the area will provide some free advice to those families. Many of the members we have within NDS provide free services, free initial advisory services to families to help them on that journey to fill that gap. But that's at a cost to member organizations that need to fund that through philanthropy, need to fund that off their own lack of profit often. Most of those providers are struggling, and if you look at the NDS State of the Sector report, most providers are running deficits now, and that number is growing year on year. And so organizations are filling that gap to make sure we meet community need, but it doesn't necessarily mean that the gap is fully filled for those families. They often need more than what can be provided on a free basis. And so I think that is the crux of the issue, is there's lots on the front end, and there's lots if you get into the NDIS, but that gap in between. And I think what's happening currently within the system that we're observing is that the community providers are trying to fill that as best we can, but sustainability is a real concern for providers at the current point in time.
So just on that, in relation to, I suppose, grants or contracts of funding that they may have with various departments, is there any flexibility to varying the contracts to actually use unspent funds in any way, or if they can't get philanthropic, then they have to turn families away?
To my knowledge, there's no specific ECI funding across the state to fund that gap. So if you don't have NDIS, I'm not aware of any other state-based or Commonwealth-based funding that would fund that, other than your Medicare rebates.
Yep.
And so families can, if there's more than 2 professionals involved, they can get the chronic disease management plan from the GP. Some GPs charge to get that, some GPs don't charge to get that. The gap that covers something around like $86.79 per session. Often the rates for therapy currently under the NDIS are $193.99 an hour, so it is a cost barrier for many families and does create a situation where even if you get that's only 5 sessions, and there's a significant gap fee for families to pay. So it limits the ability for families to access that. Outside of that, unless you are, Alice, I'm not aware of any other funding for early childhood intervention other than community health, but not through the community sector.
I guess, no, that's true. There's not specifically, but I think what a lot of organisations try to do is that we will have funding across a range of other forms of funding. And as Morgan said, so things, when you're asking about what's working well, things like supported playgroups where they're local and they're on the ground with staff who have connections in those communities. So what they'll do is we'll be able to connect with, say, child and family nurses to come and do the Blue Book checks there at the playgroup, for example, or some of the Department of Education funding programs that we might be able to run, and things like parent support groups, like My Time, things like that. They are funded for that particular type of work. So organisations will sometimes use a range of those fundings to try and support in those gaps, but the demand for those is far greater than the funding allows, and so there is still a lot of work outside of that. And I think, just to your question earlier about what is work, when it works well, I think that one of the things that does work well, that probably we don't see as much as we did maybe 10 years ago, is where you have a direct, very rapid response contact with people within their communities. So, for example, a hospital might have a child who needs support, and the hospital will know that, and the baby's born and the parents will need some support, and there'll be people who'll be able to go and support that family at the hospital, meet them so they can set them up with what they might need and help them through that whole journey. They've got other things to think about, and now that process is far more. It's a longer process, and it's more, multifaceted. So I think what happens sometimes in that space is that there can be a lack of connection and time in those networks.
Yep. I'll pass over to Mr. Payne.
Just in relation to that, so can I take from what you've just said that where you've got a child and a family that leaves the hospital and there's, a known issue that they may not have been expecting, or that has, arisen, and some sort of outreach program from the hospital, so centralised around, the hospital operation would be of benefit to those families. Is it suggested that it's lessened off over time?
Yes, I would say it has lessened off over time, but that there is a process. There is a process for that, for children to then go through to the NDIS, and that process involves the structures that have been put in place by the NDIS. And that's for some families can work well. I'm in a regional area, and sometimes that can be a challenge with some delays in that process, just because of the infrastructure and funding and recruitment.
What would be the best way to sort of, manage a situation like that into the future? If you had control of the system and operating an outreach program, would it be like an outreach nurse that would, say, visit a family after a child's been born, a couple of weeks after, a couple of days after, to see how things are progressing, provide guidance on supports that are available within the community and their surrounding areas? Is that something, or do you think a concierge, somebody that's, maybe not outreaching to the family home, but provides contact from the hospital to reach out and connect families with supports?
I think I think there probably are a couple of things to that. So I think some of those things are theoretically in place currently, because there are child and family nurse programs, and usually they work really well. But there can be situations and probably more where we're probably more talking about then for children who maybe don't have a diagnosed disability early on, or families don't know that that's the case, but in those early years where that process may happen. But then that can be very inconsistent depending on the people who are, how much action the family needs to take. Within the last inquiry about early childhood developmental checks, that was something that we were discussing, is that there can be inconsistencies for families in how much action they need to take in that. Now, a family who thinks there may be some concerns may find that even harder to action on, and the child and family nurse is very, very valuable and very important, but sometimes then it's the link into more long-term supports, and that link is not necessarily always smooth. So yes, I think that the relationship between a hospital or an early child and family nurse and some locally ready services that are ready and funded appropriately to be able to support those children is probably the bit that's still needs some work.
Mrs. Patrick?
Yeah, I might just add to that. I agree completely with Alice. I think we do have, in New South Wales, we're very lucky. We've got community health in each region, and the child and family health nurses, as a general rule, will connect with families within the first 4
And
weeks.
that was my understanding. I guess I was just interested to when you said that there was some disconnect about the connections, I was sort of wondering, well, do we need to provide more explicit instruction to the hospitals to make sure that their outreach teams are providing that connection where appropriate?
I think the trick is in those early days. The needs can be very broad. It can be everything from just feeding, sleeping, supporting, bonding, all the way through to this child maybe something that's happened at birth, or there's been a disability diagnosis soon after, or something else has come up. And so on kind of the first half of that, the community health nurses, that's what they do. That's their bread and butter. They're fantastic. And if a family can get past the barriers to access, i.e. get into the center, because usually there's not home visits for those, and there's not cultural or other barriers to accessing that as a institutional service, that can be very beneficial. But often they do drop off, and I don't know the data on that, but often families drop off after that first 4 to 6 week visit. And so I think that's where the findings, when they come out from the other inquiry, may be very helpful, because we talked a lot about that in our appearances at that. However, as Alice said, there's more specialized needs for ongoing care that a nurse wouldn't necessarily be able to provide. So, if a child potentially maybe have mobility issues, they're going to need pediatric physio and OT input probably. And so it's a more specialist service of supports. And I think that's where we would say even you don't need 5 allied health disciplines, a key worker to walk alongside the family through that whole journey, then they'll call in specialists as they need. It's that less is more. We don't need to overwhelm them with lots of people, but we do need to make sure they have a trusted relationship that can follow them. As soon as we know that this child's developmental journey may be a bit different than other children.
Okay, so we can selectively assign those people knowing that they have some difficulties and that they may need that support moving forward.
Correct,
Okay,
yes.
I've got one more avenue, but I didn't want to interrupt there. You said in opening statements that there's sometimes a gap between when there's identified issues that I guess have arisen and the access to treatment. Could you provide some insights perhaps to real life examples where you've known people to be receiving the care that they need almost immediately, and then other families that may not have, and I guess provide the committee with some insight as to what the differences are moving forward for that person that hasn't received the early intervention as other people have?
Sure. I'm really happy to give an example of that. Excuse my voice today, I've got some allergies, sorry. We've got an example in a regional area of a child who was probably about 4 or 5 at that stage, and who had actually come to us in one of the play groups that we have, who then a child may have some speech or language delay, and it's not, that in itself would not allow them access into the NDIS early intervention. And so that child would be eligible for some community health speech pathology, and then they try to go onto that wait list. It's a very, very long wait list, and they may have one session, but they had a lot of turnover in the community health staff because it was a regional area and that person had left and there was no one filling that role. And then the child was attending one of our play groups. They have then a couple of private sessions, but they can't really afford to keep doing that. So then a period of about 12 months passes, and by that time the child's speech delay has become more significant, and they're then having some social challenges. They're withdrawing within the playgroup and not necessarily communicating very well. The parent is quite stressed because they can see that that's happening. They then are getting ready to go to school, and so then when they start school they will have trouble with literacy potentially because of that speech and language delay, and that sets them up for their education journey to be more of a struggle. So in that time, that child in that playgroup, if they had had some very targeted, quick, effective speech pathology, they would not have gone down that trajectory. What ended up happening is that then they have a delay in more areas, and then they then have they go through the early childhood partner and they have an NDIS plan, and then they can start receiving some NDIS therapy, but then they are on the NDIS as a participant in the scheme, and then they will have ongoing supports. So that's an example of that.
So it's a compounding problem that if it had been, I'll say, nipped in the bud at an early stage, ultimately would have provided cost savings to the community, would have resulted in better outcomes for the child and a better quality of life for the family moving forward.
Absolutely.
Absolutely.
Yes.
And I might just add to that, I think from the family experience, we were talking about this before, it's so awful to be in a position that you can see your child has a developmental need and not know how to solve that, to not know what strategies to do. And so much of early childhood intervention, effective early childhood intervention, is building the family's capacity and their confidence and their capability to support their child. So in that instance, working with the family to identify what sounds the child can do, helping to build on that, giving them some resources like keyword signing, some visual aids. There's so many things that we can do that are very simple, and that's that, quality less is more. If we can equip them with that, they can be teaching others in that child's life. The more that child gets exposure to those strategies, the more the outcome. And it's exponential from that point in time. So then they start school in a much better position. I've also worked in out-of-home care, and we know a third of children in out-of-home care have additional needs. So the pressures on families when development isn't going as planned and they're not well supported can lead to family breakdown, we know that there's children with disability and developmental concern have a higher rate of domestic and family violence exposure and other forms of abuse. These children often are ending up in other systems because we're not acting early enough on just getting in and supporting the family with their development. It's just so critical, I think, not only for the child's individual outcomes, but for the whole system outcomes.
Is it a cost issue or is it a workforce issue? Like, do we have enough people on the ground to provide the services to children if they needed them, or is it a case that sometimes people can't afford them? Or is it a bit of both?
Bit of both.
Bit of column A, bit of column B.
A bit of both, and I think that goes back to using best practice. We don't need to give every child 5 allied health disciplines. That's a very medicalized model.
Yep.
Let's just do a weekly speech, weekly OT, weekly physio. We don't need to do that. If you look at the evidence around the key worker model, you can give the child one discipline. They may speak to other disciplines, so often if they're presenting with, say, sensory processing difficulties, you might give them an OT. The OT will then be the key worker, but then as they have maybe some issues with feeding, they might bring in just a speech for a couple of sessions, get some advice, and then apply that. So you solve your workforce issue by working more effectively, and efficiently.
Understood. Thank you.
Just following on, and then I'll hand over to a colleague. Just on that, what are some of the barriers for families to access or for workers to be able to reach out to families, particularly, and you touched briefly on rural and regional, but also from Aboriginal background, but also from vulnerable families, whether they're metro or rural and regional?
I think one thing, a huge part is just the complexity of the system is that one of the biggest barriers. The complexity of the system and having to understand what process and hoops you have to jump through to get supports. And as I said, I think depending on where you live and who you know to ask, that's the biggest barrier.
And how would you simplify that system?
I think having far more clarity about we've currently got the NDIS as one system, but if we're talking about foundational supports, I think it's looking at getting a context and a mapping of what we currently have in New South Wales, which, as we said, is a rich service model. There's rich service models out there. Looking at those very closely and deciding which ones need to be funded differently, better, appropriately, and which ones we need to have funding collaboration between services, because that is something that's quite challenging for organisations at the moment, and looking at a very holistic model that is as universal as we can possibly get it, so that access for people, no matter where they are, where they live, who they're asking, is the same.
Can I just add to that? Yeah, listen, I think the other barriers sometimes are from a cultural perspective, and the idea that currently the system is framed that in order to get access to the support you might need, you need to either acknowledge a developmental delay that's quite profound or a disability to get access to the NDIS. And that early in a family's journey, where they're seeing maybe a delay across one or two domains, that is a big leap for a family mentally to get to. And for many cultures, the concept of disability is understood and thought about very differently and can be very socially isolating. My organization works in Lakemba, Roselands. Lakemba has 89% of families don't speak English at home. And they're from overseas. They may not have family. And they tell me that if they have a disability diagnosis, they're shunned from that little community that they have. And so families are hesitant. Many families are hesitant, but particularly if you've got cultural barriers, to go, my child has a disability, I need, to go into a disability system, when really what we're talking about is they've got a delay. Let's give them the opportunity to think positively about their future. They're a little bit behind, and we're going to support them to catch up. So I think reframing that and not putting it through a disability lens and putting it through this child needs a bit of extra support with their development is one thing. The other thing I would say in terms of solutions, we do have a group of members who have been thinking about solutions, and one of the things that they've kind of landed with is there needs to be a line that families can call to say, my child's, a year and a half, they're not talking, should I be worried? And just be pointed in the right direction. In theory, we do have early childhood partners, and some of our members are early childhood partners, but depending on the region that you're in, you can wait 10 months, 12 months to even get a phone call back. And so that's a significant delay for a family to get that initial advice. Should I be worried, should I not? And the same goes for professionals. If you're an early childhood educator in a center and you're observing a child who's having maybe some behavioral concerns, maybe a little bit of developmental delay, and you don't know what to do, wouldn't it be nice that you could pick up the phone and go, this is what I've got, and just get some initial strategies? Because often those very simple initial strategies can be so profound, and also filling the gap in the meantime till families can get into more formal supports. And so I think we need to think about how to get families and professionals advice a bit quicker.
Yeah. Thank you. Mr. Leon?
Yeah, I just wanted to clarify. So does your organisation represent only non-profit providers, or is it for-profit and non-profit? Okay.
Yeah.
I wanted to ask you, in your submission you talk about an integrated model or ecosystem of supports, and I wonder whether you could provide some comment about the limitations of that model in terms of universal service provision, particularly in regional or remote areas where it's hard to actually get partners to be able to deliver services, and how we might overcome that and get some consistency in terms of the types of services that are provided across the board in the state.
Yeah. Do you want to start as a regional?
Yeah, I think having the somehow, so to answer your question about various groups of people and various providers, we need all of those providers in the ecosystem. That is what New South Wales has, is a range of people providing services in different ways, and we've always had that. But I think what we need to have is that there is, really it comes down to that there's the NDIS, and then there's very lot of challenge for families trying to access other services unless they are funded through other, as we said, some of the fundings like the Department of Education or other funding sources. So I think we do have an opportunity for more collaboration. So when we talk about universal, that one of the challenges is that the NDIS funded work is funded very specifically for that child and that in the individualised plan. And outside of that, there is not a lot of scope or time or funding for other people providing services to be working together. So I think that some of that collaboration ecosystem has been disrupted because of the NDIS funding model, so which is appropriate and necessary for some people, but in this space of early childhood supports, it's been a challenge.
And how do we kind of overcome the sort of the service deserts? You know, if there's not providers in place in, say, regional or remote New South Wales that are capable of actually delivering the same quality service that might be available in a metropolitan area. If we're not, I mean, because the alternative is a much more state-driven, direct service provision by government, as opposed to relying on secondary NGO or private for-profit providers.
I'm happy for you to answer, but I'd actually say they are actually there. I think a lot of the time they are actually there. The services provision is there. It's just that the funding is not working very well for them and for the community the way it's working.
Yeah. I would say, I think it's twofold. I think, and I know I sound like a broken record, but I think it's how we work. Again, key worker model, we've got to move away from needing so many disciplines involved, because that lessens your demand on how many people need to be involved to meet that child and family's needs. I think there's actually an incredible amount of networking already existing within the state. And so in areas that maybe don't have adequate early childhood intervention supports, for instance, where that is such a hard cohort of workforce to recruit anyway across the state for both health and for the private sector, I think that you could be leveraging those networks, fly in, fly out. Again, less is more. You don't have to be there every week to see a child and family, but you do need to be there to, meet with them in person and actually eyeball that child. We always say we need to see the child. To give those advice and strategies, and then you can be checking in remotely. There's lots of technological ways that we can work around that and use the workforce across the state. I think the other thing is with the existing early childhood intervention providers, many of which are our members, who are across the state, many of them have vacancies. It's not that we've got a workforce that is so full that that's why there's wait list. Wait lists often relate to the fact that we can't have access into schools. And so we have this huge chunk of the day that we cannot see children. And then we've got children go to bed at 7 p.m., 8 p.m. There's only limited hours after that, and it's a time of day children are tired. If you're parents, you'll understand what I mean. That's a hard time of day to do quality support to families, and it's limited hours. And so if we can solve some of the other systemic issues that are influencing that, you can better make use of the available workforce you have. And you can also, if we think a little bit more efficiently about how we do it, less is more. Provide one kind of key worker, have them in and out if they need to fly in and out, use some telehealth, but also leverage some of the existing networks that exist within the state. And New South Wales, I think, really is well positioned in that way, which is a great thing.
Another example, just to add to that, a lot of organisations will have, and services and businesses will have interagencies in their region. So there will be child and family interagencies. My organisation is part of 4 different regions. They meet quite regularly. That takes quite a lot of time. None of that is funded through anything. So those things are being done by organisations to just try to keep connected and to try and work together. And so a lot of the networks and the interagencies is an example where that's based on goodwill and community connection rather than formalised or funded systems.
There is an example in the NDS submission, I think it's on page 15 or 16, around an old funding model called the ECICP. It was $12,000 per region for organizations in that region to collaborate. And some of those regions, I believe, are still operating those, even though the funding doesn't exist. And we're happy to support with getting kind of names of those. But even small bits of money can go a long way to help organizations have the time to invest in those. Some interagencies are funded. My organization does run one for Canterbury, funded by DCJ. So some of them are funded, but it just depends on where you're at in the state and what's funded and what's not, and how much of that's done on community goodwill versus funding.
In your submission, you talk about the barriers to accessing schools, and you just touched on that in your response to that earlier question. Can you perhaps explain to me why it's so difficult to get into schools? Like, what's the impediment there that's preventing services from being able to provide, services that are necessary in school hours, in situ, in schools? But why is there hesitancy from perhaps the Department of Education around that?
Listen, I think from a departmental level, there's support for therapeutic support in schools and capacity building for educational teams. At the end of the day, though, it is up to individual principals. And so what you see across the state is it varies very much school by school. But as a general rule, it is difficult to go into schools in term 1 and at the end of term 4. Many schools are reporting to us that there's 80 to 200 different requests a week to come into the school. And so from a school perspective, that is terribly difficult to, so there's a few things, terribly difficult to administrate. There's some things that could be done to streamline that process, because every every school you go into, you've got to provide the same information. We could centralize that. That would be efficient. But the administrative burden is difficult. From a school perspective and from an educational perspective, it's very disruptive to a classroom to have that many different external people coming in and out of the classroom. From a quality perspective for the school, that's 200 different opinions that they need to process and think about how they're going to apply that. And it is very individualized rather than looking at the overall capacity building of the school. And so one of the recommendations that a group of our members in the Early Childhood Intervention Best Practice Network have made is that the funding model needs to be moved to a panel of providers per region that go into schools. Say that's 3 providers. Families can choose which one they want to be delivering their service. One of those providers should then be given the opportunity to do the capacity building with the school. And my organization is actually funded through the Communities for Children program in Bankstown. We're doing this in 5 schools every year, where we go in, we work with the school around their overall development needs for their educational team. We'll provide training for the educational team. Where they're having challenges in classrooms, we go in and do observation, and then we do capacity building for the educational team. Where from that we identify maybe children need a little bit of extra support, we'll provide that, but also capacity build them to do that. And then where there's kind of common concerns, we can do that training for parents. And it's been incredibly effective because the school is saying to us, we're not having to deal with so many different providers. We're working with you, and we're actually able to focus on what is our capacity building needs. And I can also say, as an early childhood education provider, and this is speaking on Karana's behalf, but we really struggled with this for our early learning centers. We provide 25% inclusion for our preschool programs. We reserve that. We always end up with more than 25% because you don't know at the start of the year who actually, there's lots of children that may emerge over that period. And we had to make a call to say we actually can't have external therapists come in unless we don't provide that, because it's too disruptive to the classroom for those children to have lots of people coming in and out. And so what we have now done is revise our model. We've got an integrative model, which I'm happy to speak more about or have a visit to look at. But for us, we will have a therapist there. They're there for the whole day. They're not coming in for an hour. If that child needs, some children need support at transitions. So you need to be able to work at the various transition points to support them. Some children need support towards the end of the day. If the therapist is coming in the morning, that's not helpful. They're not seeing the support that's needed. And we have found the outcomes from that to be really profound in terms of the impact on families, the impact on the educational team. And so I can really relate to the challenges schools are having, because that's what they're experiencing on steroids. I mean, they've got, as I said, 80 to 200 therapists a week. That's very hard to manage and incredibly disruptive for them. So I think as much as choice and control is important, we've got a very transactional funding model that is not supporting quality. It's supporting that more is more, not less is more.
Thank you. And Mr. Martin?
Thank you, Chair. Did you have anything that you wanted to? Okay. Thank you, Chair. And thank you both for being here this morning. With the few minutes that we have left, I just want to give you both the opportunity to answer an extremely open-ended question, keeping in mind that the state government does not have access to an unlimited budget. With that in mind, what would be at the top of your list of priorities if you could have something granted from the state government at the end of this process?
You go first.
It's a very good question. I guess ideally, looking at the submissions you've had for this inquiry have been broad and fantastic, but also have some very similar themes. So I think, having looked through those, I think using those as the main point. I guess looking at the ecosystem and the infrastructure that we have currently and services across all different types of services in New South Wales, looking at trying to fund appropriately the models that will allow families, rather than being funneled only into something that is deficit-based so that they can get the support, how can we build on services that we currently have which are working well and connected in communities? I think that's really important. I guess ideally, you want a family to walk into a local service who knows their community and their referral pathways and all the options out there. You want to have be able to have access to evidence-based supports quickly, no matter where they live and if they've got the funding or not is probably the big key part. and whether it's health or education or a private practitioner or an early childhood intervention provider or preschool, that they are all talking the same language, that we have a good system, and that there are no sort of funding wars or barriers about who's providing what or how many people are, that there's no funding for collaboration around that child, because the child and the family need to just be able to walk in somewhere, and a model where it is strengths and outcomes based, that a family can say, I've got some concerns, this is where you go to, and these are all the options for this service that'll work together. How we can have a family know that if we provide X, Y, and Z, then it will all be good, this will be the outcome, rather than saying, well, to access this, you need to do X, Y, and Z, and then you access it, and then now you've got to go find somewhere to go, and that it's really confusing for families. So for me, it would be about looking at what all of the providers out there and trying to work out ways that we can fund really appropriate best practice intervention.
Thank you. Ms. Fitzpatrick.
I think for me, this is probably not going to surprise you because I think I've said this a lot. I think, so at a very high level, I think we have to think about children's services differently. Children exist within the context of families and schools. And too often, we're treating disability supports for families like we do adult services. So we've got to think about, it's about not just intervention for the child, it's about the support for the family and support for the schools and the systems that sit around them. And that means we need to fund it differently. It can't be transactional. It needs to be more at a capacity building level. And I think the one thing is making sure that families can get access to that holistic key worker type early childhood intervention outside of the NDIS. As soon as developmental concerns, delays, or differences are identified, families should have access to that. And I think we then avoid NDIS, we avoid extra support in schools, we avoid all sorts of things if we can just get that support early under a less is more that I've described. Yep.
Thank you very much.
And sorry, can I just add one more thing to that? Sorry. The other one is just looking at diagnostic services, health diagnostic services in the state, because that is probably, that does have a significant impact on where families can go and how they're funded, and that is an enormous barrier.
And the earlier the better.
The earlier the better, and that it's not necessarily linked to the only way of getting supports and funding.
Yeah, I was going to really important. I think because if you can actually do away with that being the requirement to get the support and do that earlier, then it's fine that it's later, but it does need to be funded. It's a huge cost barrier for families. But yeah, if you could be getting families that support just with a screening tool. There's many evidence screening tools that we're using, community health is using, everybody's using. We know when there's delays or concerns, we just need to channel those families to the early intervention, and right now they're just not getting that. Yep.
Thank you.
Thank you very much. Unfortunately, time has run out, but again, thank you very much for coming today. I don't think anything was taken on notice, but there might be a couple of things we want to follow up afterwards with supplementary questions.
Thank you.
Thank you very much again.
Thank you for the opportunity.
Thank you.
Hello. Anthony, if Mark wants to ask a question, can he message you? Because we can't see him. I don't, rather than just calling it, okay? Yeah. I'm mindful he might, you know, step away or something. Miss Splenda Smith, can you hear us? Just wait. She'll come back. Hello?
Hello.
Hi, how are you?
Hi, good, thank you. Apologies, for some reason I got kicked out.
No. If it sometimes happens. Just so you know, we have another colleague, Mr. Mark Buttigieg, who is also online, but you may not be able to see him in the room. Can you see everyone? Probably not. We have Mr. Murphy and Mr. Diadam from the government, Mr. Fang from the National Party, Mr. Martin, Independent, and also Ms. Abigail Boyd, who is also the Deputy Chair and member of the Greens Party. Before we commence, could I ask that you either take or swear the oath or take the affirmation? I understand the words of both have been sent through to you.
Yes, that's correct. Megan speaking. Just one thing to note. I apologise if I am not well, so if I start coughing during any of this, I do apologise, and I will put myself on mute. So I'm going to take the affirmation. I solemnly and sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thank you very much. Is there an opening statement that you'd like to make before we commence?
Yes, just a short one.
That's fine.
Thank you. So my name is Megan Spindler-Smith. I'm the Deputy CEO of People with Disability Australia. As part of what we do is we represent all people with disability all across Australia, but also in New South Wales. And as part of that, we want to ensure that foundational supports in New South Wales are not only disability-led and part of a genuine co-design process, but when we are defining what those look like and how effective they are in the future for children with disability and adults with disability now and moving forward, we want to ensure that all marginalised and disadvantaged cohorts are recognised, supported, especially because New South Wales is such a broad and diverse community. And what we do not want to see in any way, shape or form is an accidental postcode lottery. We want to make sure that all foundational supports continue to meet the social model of disability and also meet the human rights obligations under both the Convention on the Rights of Persons with Disability as well as the Convention on the Right of the Children. We do want to make sure that any future understanding or supports for children and young people with disability recognises that this is such a critical time for children with disability to be able to be part of society in an equal and equitable basis. And we want to ensure that any societal attitudes, communication barriers and environmental factors are able to be dealt with or supported rather than problematising a person with disability. Therefore, as part of this, we really want to encourage that New South Wales, who has such an important role within Australia, not just in New South Wales, in ensuring that foundational supports provide a strong basis for choice, control and will and preference of all children, young people and adults with disability. Thank you.
Thank you very much. First of all, just so you know, we've decided amongst the community that we'll have what we call free-flowing questions, so it's not structured an allocated time. But I also just want to begin by thanking you for the work that you do, not only here in New South Wales, but across Australia as well. And on behalf of the committee, if you can pass that on to your other members as well. I might begin in relation to this survey, the member survey and forums that you've held. I'm interested to hear, and you talked briefly about in your opening remarks, what you called location lottery. Wanted to hear a little bit more about some of those findings from the survey and the forums. What does that mean, and what are the experiences that your members have been having in relation to accessing services?
Megan speaking, thank you. So, what we have heard from our members is that if you are in a regional and remote area, if you are not in a central part of New South Wales or across Australia, but we'll speak to New South Wales today, what we find is accessing any sort of foundational supports or disability supports for children and young people and adults are almost impossible to find. If they're not possible to find, what the issues they then find is that they are not culturally safe, they are not disability affirming, and what they do is not primary a social model of disability. Primary a medical model of disability. The problem that lies with that is that without access to disability affirming style processes for being able to develop communication, capacity building, what we are seeing is those from diverse social and cultural backgrounds, from First Nations communities and from the regional and remote areas are not being able to access what they need in a timely manner, and it is setting them behind their peers, including their peers with disability. And what that then means is that they are less likely to be able to access the supports they need to be able to have longer choices and control around what their life are. But also what we have seen, and what is probably the most interesting part of this postcode lottery, is that when you cannot access these, then you can't get off what we call the polished pathway. And what the polished pathway is that you go from segregated education, you go to segregated employment if you are even able to access that, and you are also going through all segregated choices. So you are not being able to play a critical role in society because you haven't been able to access these in a timely manner that actually meets the needs of your family's requirements.
And are they also saying that they're having issues accessing information, or is it they know where to go but they can't actually access the services?
Look, it is both. It does depend on where you are. However, accessing information is also very difficult, partly because what we see is trying to get access to, first of all, the information about what disability is occurring, what is in need, what are the support mechanisms that are available, are almost non-existent, but also getting access to diagnosis, getting access to any forms of therapy or occupational supports are almost impossible to even find the information where you would go to do that in regional and remote areas, and especially in First Nations communities.
And in those surveys and forums, have your members come forward about the type of design or the process for designing foundational supports and what they would like?
Absolutely. So what they have said is, first of all, it needs to be done with us and with our community, and that includes with the children that we are talking about. One of the things that gets left behind a lot of the time, and this is discussed as part of the Convention on the Rights of Children, is that children and young people are not actually included in the design of what actually is needed. So that key co-design and direct collaboration is what is being requested, so that these supports are disability and person-centred, and especially they then allow for that space of the intersectional lived experiences for our very diverse New South Wales.
And you said it's what's being requested. Can I ask what level of engagement have you had as an organisation to date from a federal and a state perspective?
Sorry, I probably need some clarity on what you mean by that, as in for co-design?
Yes, yep.
Okay. So at this stage for co-design, there has not been a high level of engagement around foundational supports from a federal or a state perspective. As you may be aware, there was an announcement recently, as in I believe this week, And I apologise, I have been sick, so I'm still catching up a little bit on the week. But there was an announcement that foundational supports will actually be delayed and that will not be going ahead on the 1st of July. So at this stage, the co-design level has been limited. However, for the children and young people aspect, there has been more involvement at a federal level. We have not seen as much at a state level at this stage, but we do understand that there is a lot of back and forth required because of the agreement, where foundational supports does have a strong federal level focus and drive at this point.
Any, do you want to?
Yeah, thank
Ms.
you.
Boyd.
Thank you very much, Chair, and good morning. I wanted to pick up on this issue that you raised in relation to people falling through the gaps or being kicked off of NDIS before they then end up getting the support that they need. My office also has a lot of people coming to us with that concern. Could you tell us, I guess, give us a few examples of the people who have contacted you and what that looks like and what the impact on them has been?
Absolutely. Obviously, I do not have permission to share specific names, but I can give you some cohort demographics versus specific names or details. However, probably the biggest issue is for autistic children. We are seeing a high level of autistic children not either no longer being part of the NDIS or not being placed on the NDIS at this stage. And so what that then means is that for these children, they're not getting access to what we know for fact are pivotal services and supports that will ensure that they can access education, employment, and have long-term positive psychosocial health outcomes. Because one of the things that we do know is that for autistic children, when they are not provided access to autistic affirming and disability affirming supports at a young age, at this early intervention stage, which is what we're being discussed, what we do see is an increase in psychosocial disability in the future, and we need to ensure that we're able to provide them those supports. So we're seeing this. We're also seeing that children who have early intervention requirements but do not have classic diagnosis because of the fact that they are showing that they have disability needs or impairment needs, but they do not necessarily fit within a requirement of a diagnosis because of their age, because many disabilities cannot be diagnosed at a very young age. Because of that, they're not necessarily being able to access or not meeting the impairment or disability requirements, and therefore they are now losing access to any sort of base supports under the expectation that there would be general foundational supports available for them to move into, which obviously do not currently exist.
Can I also ask you, one of the things that you draw out in your submission is in relation to the, I guess before all of these changes were announced, the disparity between different regional locations when it comes to the ability to access diagnosis and early interventions. Are we anticipating that will get worse rather than better under these changes? And I guess what are your members telling you in relation to that disparity?
Look, it really depends on how foundational supports are implemented. If they're implemented in a way that means that access is not specific to services being available in peak areas only, then we will not see an increase in disparity. Hopefully, if foundational supports are implemented in a way that primaries, regional and remote access needs, then we will not see that. However, at this stage, there is not the services or the infrastructure available in regional and remote areas. And so what we are hearing from our members is that they have fears that if there is not a strong foundation to foundational supports, and I don't mean that in a joking way, but if there is not a good structure or infrastructure that is regional and remote start or focused, then what you will see is a lack of access or a need to bring children into peak or main cities, which then could create burden on main cities that it is already currently doing and increase that because they will not have access to additional funds through the NDIS that they may have been able to access previously.
Thank you. Just one last one, and then I'll hand over to my colleagues. Learning disabilities are often referred to as learning difficulties rather than being disabilities. And that often results in children sort of, not getting the supports they need throughout schooling. How do we ensure that children with learning disabilities get the right support from an early age?
The big question. So one of the issues is when we talk about learning difficulties versus learning disabilities, what is not recognised under a difficulty model versus a disability model is that intervention is needed regardless and support is needed regardless. The issue is when we label something a difficulty versus a disability, we actually ensure that we say this is something that will pass. Now, it is likely if you get the right level of support that a learning disability will be able to be supported and engaged and grown through. However, if we do not provide a similar treatment regardless of label, then what we're going to be seeing is children that may not be able to move past their learning difficulty as it's being referred to. So there's two things. One, we need to actually change attitudinal expectations around what the word disability is, because a lot of people, as valid, when they hear that their child has a disability, it is a lot more palatable to say that you have a learning difficulty than a learning disability, because there's an expectation that difficulties are something that you just get over and a disability is something that makes you less than. And that is an attitudinal situation that we do see on a very regular basis. So it is about actually changing some of the attitudes, and we know that foundational supports can help and should also target attitudinal change within the community. But secondly, we also need to make sure that in schooling settings, in education settings, children with any sort of learning disability or difficulty are able to access support needs regardless of what it is that they're labelled as and based on what their support need is. If we focus on the support need and only the support need, then we are able to develop children and young people regardless of societal expectations or labels.
Thank you.
Thank you. I might pass to Mr. Diadam.
Yeah, thanks. I want to pose a question to you. A lot of the children that we see in the justice system either have a disability or have a disability that hasn't been diagnosed. And particularly in Western New South Wales, where we've got high levels of juvenile offending. Is this something that is a product, you think, of the absence of appropriate foundational supports being in place?
Megan speaking. Look, thank you for that question. Justice and justice settings are one of the most problematised spaces for children and young people with disability because of the fact that absolutely the lack of access or lack of access to either diagnosis or just a support needs focus means that children are more likely to demonstrate what are referred to, and please note, we do not necessarily think this is a valid terminology, but behaviours of concern, which then put them on a justice pathway. If those behaviours of concern are not supported in a way that primaries, the communication needs, or the support needs, or even disability needs of the child or the young person, the likelihood of them being in the justice system is very high. We also know that that is even more so for First Nations children and young people, because of the fact that there is already a high expectation of how they're going to be able to engage with that. So I could not say, and there's no data that says that lack of foundational supports puts you on a pathway to justice. However, what we do know is lack of communication and education and environmental supports for children and young people with disability will increase the likelihood of them not only being in touch with the justice system, but sadly remaining in it as a youth and potentially as an adult. And so we know, and there is a working group currently working specifically around intellectual disability and the justice system across Australia, looking at how do we combat that and reduce that fact, because we do know that once they go into the justice system, they are not going to be able to access any form of disability support need, and therefore they are likely to have compounded issues and long-term justice touch points. So there is not research that directly says foundational supports, but there is research that says that lack of support and lack of access to supports for a child or young person with disability will increase their likelihood of having long-term engagement with the justice system.
You mentioned in an earlier answer about non-culturally safe service provision. Could you perhaps give us some examples of what that looks like?
Absolutely. So please note that we are not a First Nations led or run community as an organisation, and so I would always defer to First Peoples Disability Network when it comes to providing stronger and clearer information on this. However, what we do know is that when it comes to First Nations or culturally linguistically diverse people, and please note the needs are very different based on these different communities, what we do know is that the lack of access to First Nations focused disability services that are appropriately funded and led by people who are First Nations themselves has shown that it means that access to understanding what disability means within this community, how it works, and what are the expectations have meant that children and young people who are First Nations and with disability are much further behind in accessing support. What it also means is that they're not getting access to their elders, to the cultural learning that they need or require, because we are placing expectations on this community around how disability should be worked with and engaged with and discussed. And that is not viable for First Nations community. Damien, who is the CEO of First Peoples Disability Network, is always the first to say that the First Peoples do not have a word for disability. And the reason they do not have that is because support and engagement in community was just a standard expectation, and the expectations around risk and support needs are seen as different culturally than they are within the non-First Nations community. For our culturally and linguistically diverse community, there is more stigma, and I would always defer to either NIDA, who is the National Ethnic Disability Network, or Yvonne at the Multicultural Disability Network to give more details on this. However, stigma and expectation around disability is much higher, and so the likelihood of culturally and linguistically diverse children and young people being able to access support services or even having a disability recognised in the first place is very low, because they're being expected to go into a set of services that are not either language viable or culturally viable for what the community needs or expects. And so it is really important that groups like the multi-ethnic, geez Louise, apologies, you can tell I'm not well, and NEDA are the ones leading those conversations and making differences when it comes to access to foundational supports.
You talked about this, I think, I don't know whether you used a specific word, but a postcode lottery in terms of service delivery. What can we do to remedy that? I mean, there's obviously, particularly in rural and remote New South Wales, difficulties in terms of getting expertise in situ. Do you have any specific suggestions or recommendations on how we address that geographical inequity in service delivery?
Yeah, absolutely. So one of the things that we do know is that we need to find ways to encourage and prioritise the expertise to actually go even temporarily into the regional and remote areas. We have seen success where there are OT roadshows or support that is able to go out into the community and educate the local community on how to actually build the support mechanisms or even to stay. One of the things that we also know is that currently the disability services community and providers are in droves leaving regional and remote areas because it is too expensive to stay there and continue to provide services. So if there is ways that we can make sure that we are encouraging additional funding to ensure that the more expensive it does cost for people to access these services or even provide these services in these areas so that they are not leaving because they cannot afford to stay, that would be one of the quickest ways to support. Now, I recognise that that's asking for money, and money's not always an easy thing to do, but also providing in-community based education is really important. We have seen success where people are wanting to go back to their communities, but being able to access the education within the community to build up the skills needed for foundational supports, it does require a period of time where we're sending people to work with the communities so that the communities can develop the supports in the way that is right for them. I would also suggest is that any type of foundational supports take a regional and remote first approach.
Thanks.
I have a couple of other questions. In your submission, and it's on page 12, you talked about there needs to be a clearer distinction between targeted supports that are specifically for the 0 to 9-year-olds with disability and the general foundational supports. Could you actually outline what would you like to see in those definitions?
Megan speaking, absolutely. So when it comes to foundational supports, what we want to see is very clear 101 what every child with disability or with any sort of support needs being able to access. So that is around things like access to diagnosis, access to educational supports, access to communication supports, access to being able to utilise any form of tool. For instance, for some children and young people with disability, they do need specific types of clothing for either sensory reasons or actually because their disability requires the needs of specific types of clothing, which are not always easy to access or are actually more cost impactful than other forms of clothing. So basic 101 things like that. Also looking at things like education for providers, community attitudinal changes, and clearer pathways around how children and young people with disability are able to still have choice and control in where they have education, where they access their either medical or disability needs, and also to ensure that their voice and their choice is at the centre of it. So that may be supported decision-making mechanisms so that their decision-making power is able to be utilised as part of that. When it comes to targeted supports, what we need to make sure is that children and young people who have much higher needs or needs that require more intervention or support are able to access those without getting stuck in a medical system or being held back due to timeliness. So that could be around access to home and living supports, whether that's somebody who comes into a home to provide direct support, or it could be around changes to a building to support those sort of things. Additionally, additional education support, so one-on-one support for children to ensure that any of the barriers that they are facing are able to no longer be barriers, and therefore they are able to grow and develop in the same way that all other children have the right to access. When it comes to targeted supports, one of the things to be cognizant of is that there is still more to be done around what that looks like in New South Wales. And so when we say foundational supports as a general measure, that is something that any child with developmental delay or any other developmental needs could access, whereas in targeted supports should be specifically focused on making sure that a child that requires more support and requires more ability to be able to access everyday life is able to be focused on. So whether that's additional education supports or other things like that. At this stage, there still needs to be more work done on what that looks like and further scoping to see what that means for the wider New South Wales community.
And following on that, in relation to further scoping and engagement and the co-design, what recommendations would you have around how governments can, federal or state, can better engage actually with young people to hear directly from them and their lived experience?
Absolutely, Megan speaking. First of all, I would always recommend that working with experts like SIDA, which is the Children and Young People with Disability version of us, I guess is probably the best way to put it. They have a lot of experience working one-on-one and ensuring that the ability for children to communicate their needs, have decision-making power and autonomy around what their support and access needs are. They are absolutely the experts in this space, and I would not portray to say that PWDA is the experts in that space. The other thing I would suggest is to not only focus on carers and families and parents' decisions around this. Children and young people, we have shown, and there is a lot of demonstration either under the Convention of the Rights of the Child or Convention of Rights of Persons with Disabilities, that children and young people having access to things like supported decision making as part of co-design processes, as well as having forums and being able to meet children where they are. So whether that is using different forms of communication tools, or whether it is around making it a more engaging or involved process. For instance, giving evidence like this would not be something that a child or a young person should be expected to do in an effective way. Instead, it should be more community-centred discussions with the support and communication support needs of any child with disability. Co-design should be at the core of what we're doing, and it needs to represent what the community looks and feels like, and that includes the actual children, not just parents, families and carers. Please note, parents, families and carers are imperative when it comes to children and young people, when it comes to their developmental needs, but it should not be the only way we move forward when we're developing or designing foundational supports.
And just one final question. Obviously, look, foundational supports, it is focused around that 0 to 9. However, our inquiry is looking at supports for young people more broadly. I'm interested to know if you have an opinion on the role of youth hubs, but also other means to provide that support for young people over the age of 9 and up into 18.
Youth hubs, yes. So when it comes to youth hubs, absolutely, they can be very well placed to provide those supports. However, not all youth hubs are accessible, whether that be from a physical accessibility perspective or from a sensory or safe space perspective, or they may not be actually accessible for children and specifically young people with disability in a way that means that they can engage with their counterparts to grow and learn on equal footing. So yes, absolutely, they are extremely important because children and especially young people with disability should be able to access the same spaces, but currently not all of them are accessible. And sadly, sometimes the ones that are still have segregated programming.
All right. Any other questions? No?
No, I don't think so.
I just want to ask, so in your submission you raised the issue of disputation over the definition of foundational support. So I wanted to perhaps give you an opportunity to kind of give some clarity around what do you think foundational supports should be?
Megan speaking. It's a very big question, and I think it's something that right now needs to be fully co-designed with the community, and it hasn't been. So foundational supports need to include things like communication support requirements, educational pathway supports. It needs to also include things like access to basic mobility support needs. Anything like that is not currently covered under the NDIS, especially for those that cannot access the NDIS, the support needs that means that they could equitably access the community, that is what foundational supports should include. It is a wide-ranging set of things. The key is it should not be something that is purely embedded in a medical system, because disability supports are not always medical. Sometimes they are about getting access to verbal support needs, for instance. So it should include things like accessing OT, diagnostic support, especially for those that cannot afford or cannot access diagnostic supports, as well as any OT or physiotherapy or any of the basic things that ensure you can equally access the society if you are not able to get more deep or NDIS-based supports.
Thanks.
Thank you very much. Unfortunately, our time has expired. But again, thank you for coming today. And you haven't taken anything on notice, but if there is any supplementary questions, they will be sent through to you. So thank you very much again. And I hope you're feeling better.
Thank you so much. Thank you for having me today.
Bye.
Bye.
I think we're off. Yay.
Okay.
Thank you very much, and welcome back. Before we begin, I need to ask that you please state your name and either swear the oath or take the affirmation. I understand the words are in front of you, and we might start with Mr. Usher.
Yes, Colin Usher. I swear the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thank you.
Hello, my name's Kerry Dominish. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
Thank you very much. Would you like to make an opening statement before we commence with questions?
Yes, thanks. We've prepared one. So, thank you, Chair and committee members. We also today acknowledge the Gadigal people, elders and land that we meet on today. Our key message in this time today is that community-based not-for-profit providers are essential to rebuilding early childhood intervention in New South Wales, yet their contributions remain under-recognised and under-resourced. We commend the inquiry's focus on the early years, but believe the current system is fragmented, underfunded and inequitable, especially for children outside of the NDIS and those from Aboriginal and culturally diverse backgrounds, and families in rural and regional areas. We're here today representing the Early Childhood Intervention Best Practice Network, a coalition of 20 not-for-profit organisations across New South Wales with an average of 55 years early intervention experience. Together we support more than 22,000 children and families in the early childhood learning space and over 6,500 children with developmental concerns, delays or disabilities. Global evidence is clear that early intervention works. When delivered collaboratively and aligned with best practice, it reduces long-term supports needed, improves outcomes and is cost effective. We urge the committee to recognise and consider the existing ecosystem of trusted community-based providers who are already delivering these outcomes in any future co-design or implementation of foundational supports.
Thank you.
Kerry.
Thank you. I'd like to acknowledge the Aboriginal lands on which we meet today and elders past and present. My name is Kerry Dominish. I'm the CEO of Early Ed, an early childhood intervention service that operates across northern western Sydney and all the way up to the Blue Mountains. I'm also a co-chair of the Early Childhood Intervention Best Practice Network, of which we're representing today. And I'm also just want to acknowledge that that I'm a board member of the Toy Libraries Australia. Early intervention providers have always invested in services that are now being termed as foundational supports. These include services like supported playgroups, such as those that are run through the Targeted Early Intervention Funding through DCJ, inclusion supports through toy libraries and supports to educational services through Start Strong Pathways and sector capacity building funding, and family support such as My Time programs. And as well, on top of that, we also provide parent capacity building funding, which is often delivered through philanthropic supports. Since the rollout of NDIS, we have been filling in the gaps that address the lack of early childhood intervention supports when there are concerns about child's development. These services ceased or have long wait times, particularly in our rural and remote areas. This is unfunded work that we undertake that places significant pressure on our organisation's sustainability. We are now struggling also to absorb the increasing number of children who are no longer eligible for NDIS when there is a lack of alternative services in the community sector. The network suggests that the way to a robust, connected foundational supports ecosystem is to focus on rebuilding and strengthening foundational supports that are already in place. Coordinate the currently siloed services supporting education, child development, health, disability, and the child and family and social services sector. Reinstate and fully fund New South Wales not-for-profit early childhood intervention providers, as they are central to foundational supports. They are already in place where children live, learn and play. They are community-based, they're local, they're skilled in delivering what is evidence-based capacity building practices and the key worker model. Early childhood intervention providers are an essential component of foundational supports. They keep the early in early intervention. The way to get NDIS back on track for children is to make sure children and families have the right support at the right time. Thank you for having us today.
Thank you very much. Just by way of background for the committee has resolved that we'll have free-flowing questions, which means we're not allocating specific times to members. But I'll commence and then hand over to my colleagues. I might actually start with some of the opening remarks that you made, and it came up in previous with previous witnesses about, I suppose, the high demand for services, but the uneven distribution of being able to access services. I'm interested to know what are some of the concerns that are being raised by families about not being able to access services, particularly from a regional and rural perspective, but also from Aboriginal and also vulnerable communities or individuals. Do you want to answer that?
I can.
Yep.
Have a crack.
Yep.
I think some of the concerns or things that are being raised by our families in our region. I am the CEO of Shaping Outcomes. I serve, our organisation services northern New South Wales, so from the Tweed border right through to the Central Coast around Coffs Harbour, Grafton, and everything along that coastline and inward a bit. So we hear a lot about wait lists for either community health or NDIS access. Can be 10 to 12 months from an NDIS access perspective, can be up to 24 months for community health access. When you're raising a delay or a concern for a child, that is a significant delay, because best practice shows that the first 2,000 days in an early childhood development is critical. So if you're waiting a year to 2 years in that space to get those delays addressed or even identified, you're going to have significant impacts long term, and further delays are contributed to through that process. So that timing is a matter of concern. There is a concern that the NDIS is the only option available or to get funding, and so it has pushed families into seeking out medicalised diagnoses for conditions that may not necessarily need a full diagnosis support. There may just be delays or concerns, and so we've seen increased push for diagnosis on that front, and yeah, so that's probably the two big ones, and also the identifying families don't necessarily want to have their child labelled with a permanent disability. Because for some of those delays and concerns, as you may have heard in some previous witnessing statements, that if early intervention or early strategies that are put in place can actually resolve a lot of those issues early on and bring developmental stages up to speed with their peers in that time frame. So, yeah, that's probably their biggest concerns.
Can I talk about the culturally and linguistic diverse communities and the more vulnerable ones? As was mentioned previously, also a lot of families don't really know where to go. They are unsure, and they aren't really very trusting of the community. They're, particularly if they're refugees or new to the country, they don't really understand the system, and they are not necessarily connected with community services very well. So going to some other service where they're already connected, say with a local multicultural group or something like that, is going to be another step for them that's going to be too challenging. And I think we also need to be very concerned about and consider the needs of those families or any family that doesn't really want to go down a pathway that is a bit fearful, as Colin said, about kind of really having to think about the fact that their child is not developing well. We need to be supporting them on that pathway. So I think sometimes we hear from the families that are already advocating for their children, but I do feel very concerned about the ones that aren't. And they're the ones that turn up at school without having had any supports.
So it brings, I suppose, the question, what is the best practice model, and how should it or could it be funded?
I guess that the best practice model is doing it early, finding ways to support families to access services by connecting with them in trusted places where they are already they're already experiencing connection with the community, such as playgroups or their multicultural community, and then also thinking about a model that really uses what we know is really evidence-based practice, which is a transdisciplinary key worker model, where we're really walking beside families, giving them the small amounts of support that help them come to terms with what they need to be thinking about, and then also capacity building them to know how to respond and support their children. One of the things that the Best Practice Network that we're representing today has been doing is we've actually been really digging deep and thinking about what would this model look like if we could wish for something. And we do have an example of a key worker model that we have with us
Great.
today.
That was my next question.
Which I'm happy to share. I only brought 3 copies, sorry, but this is confidential at the moment. But it's just our thoughts about what we feel could be a model where we're really supporting families at the beginning with maybe an information line like we used to have, and being able to then connect them up straight away with supports that will give them at least some initial support to know where to start, and then continuing with them as a key worker, a one person, connecting up all the services that are around them to ensure that everything is aligned, and that they're also connected with other services that are not early intervention related, such as early education, or if they need some health supports. So the key worker model is a bit like the glue that connects everything together and coordinates everything together. So I can present this to you later.
And you mentioned that it was confidential. We can resolve as a committee later on that be kept confidential if you're happy with that.
Yes,
Yep,
yeah.
that's
It's just, it's we put a lot of work into this because we're bringing all the experiences of what we have now, what is happening currently under the NDIS model, but also the experiences that the sometimes 45 years of early intervention that we've been delivering has shown us has actually worked, but has because of the NDIS has been kind of nudged to not exist anymore, and to be able to bring back some of those functions that used to be very effective, such as capacity building for families and running programs like Hannon language programs that are a 12-week parent training program that give families lifelong supports and knowledge that they can use for their children across their lifelong, like their early years.
Before I hand on to my colleague, obviously there's recently been an announcement by Minister Butler in relation to foundational supports and not having a specific time frame as to when they might land on the state-federal agreement. You touched briefly on some of the funding issues in various organisations, but I'm interested to know, I suppose, what's that uncertainty. What concerns are out there within the organisations, but also the community, as to not knowing what is happening and where things are going?
Yeah, I think the biggest concern is the current sustainability of early childhood intervention providers that are currently in the system. As we heard earlier, the New South Wales early childhood intervention ecosystem was actually very strong for probably 10 years ago, prior to NDIS, and since the rollout of the NDIS, that network and that ecosystem has started to be eroded quite considerably due to the market. The market that the NDIS created more so, and because of the NDIS became the ideal or the only function, a lot of state-based funding has dissolved or been moved into other areas. So there is a sustainability issue from organisational perspectives, as we mentioned earlier, and as we have in our submission. A lot of the funding for those who don't meet NDIS requirements is actually being sourced philanthropically or through grants and through other fundraising avenues by our organisations. My organisation, for one, we have what we call our First Steps program, and it's currently funded through Club Grants New South Wales and through some other fundraising that we do. And because they're locally and community based, they understand our supports, but we provide supports for children that don't actually have NDIS or don't meet NDIS requirements, can't get into community health because of wait lists and whatnot, or don't want to go down that full diagnosis pathway. So we support, at the moment, probably nearly 70 to 80 children a year in that process, just in our Tweed Heads area alone. And we provide them with early intervention supports, 5 to 6 hours of supports where we can help families understand diagnosis, advocate for them in the NDIS access space, give some levels of visual aids and supports to them. But we can't sustain that long term if going forward. It's unfunded everywhere else, and as long as the funding's there through our community, we can support it. But if that dries up, we won't be able to do that. So there is a huge sustainability challenge in that space moving forward, and that sort of stuff used to be funded under ADDIC and Better Start funding and those sort of things previously under state-based programs.
Can I add to some of the kind of, so we're more metropolitan and Western Sydney and supporting a lot of called families. Some of the challenges to us at the moment are that there's recommissioning for funding that for the targeted earlier intervention. There is also recommissioning underway, and that we're not sure where it's going to go with the Start Strong Pathways funding that Early Ed is accessing. That is the money that is actually doing such a lot in our community, because we're creating inclusive communities by supporting our multicultural playgroups and community groups to create community programs that are culturally appropriate but also inclusive for children with a disability, so that they don't have to be going off, really thinking about where they can get social and family and community support. And that kind of funding, that is kind of making us very nervous. There's been no increases in funding for the Start Strong Pathways funding for a long time. So we're doing less with the funding that we have because it's not possible anymore. And yet it is incredibly valuable a service that we can offer and gives us real flexibility. We have staff in our teams that are doing foundational supports for families, because particularly our team leaders that take a call from a family who really doesn't know where to go, and we're supporting them to look at what the options are for themselves, invite them to free programs that might be in their community, but then also supporting them to work out and be prepared to manage and be ready and cope with the pathway to NDIS, which is very concerning. I guess the other thing that's happening right now is that there have been some legislative changes that are putting increased pressure on providers like us, which is the Section 33, which is really not going to support the needs of children, that came in on the 19th of May. Which is, I can tell you more about that if you want to know, but there's also other things like the...
Sorry, just Section 33.
33 of the keeping NDIS back on track, that legislation. It's to do with quarterly payments, which is going to make it really difficult for families to manage, particularly if they're in crisis or if there is some emergency supports they need. The legislation is really encouraging making some shifts in children becoming not eligible for NDIS anymore. That used to really happen when children were 6, and so it would happen really when they turned 7. Now it's really happening when they turn 6. So there's less children in the system, and also families are getting less funding in their packages. Which is also meaning that they're going to have to either fund it themselves or be able, try to source that support in the community. All of those things are having an impact on our referrals, and also putting a lot more pressure on families to kind of really eke out every dollar they can from their packages. All of those things combine, as well as the fact that we're doing a lot of support for free, like last night I spent, as well as preparing for this, spent some time putting in a grant application for the Auburn area for a baby group to support families through club grants, because that's the only way that we can support our community and get the supports in really early for families.
Thank you very much. I'll hand over to Mr. Murphy.
Thank you, Chair. I just wanted to go back to the issue of which model might be the best one. In your submission, you drew our attention to 2 international examples, the Early Steps program in the United States and the Sure Start program in the United Kingdom. They seem to be quite different in the way that they apply, and I just wondered, you may have answered this by saying that you've come up with your own model, but I just wanted to see, well, what are the specific lessons from each of those that we could draw together that could apply well in a place like New South Wales, where we have enormous diversity, We have service provision that will have to happen across metropolitan and rural, regional and remote areas. What aspects of those international programs do you think we can learn key lessons from and roll out here in a model?
I can make a couple of comments and you can follow. Okay. So I think those programs are about local supports, trusted organisations that are working within that community and supporting the community and identifying, connecting with families that feel trusted, that are, trust the organisation. You can't just walk into an organisation like a playgroup and float around without people being concerned about who you are and what you're there for. You have to visit and be trusted and known by the support service that's there. There's other programs as well that I put another submission into the inquiry around supporting babies early, and I did notice that came up in conversations in one of the previous submissions this morning. That's the early intervention SMART approach, which is recognising that children that have been in neonatal care have very challenging pathways after birth, and that a medical model which is supporting them in hospital isn't really fit for purpose if those children then have ongoing needs, which they all do because they've had the experiences that they've had. But supporting them after the maternal health nurses have undertaken the piece of transitioning them home to have ongoing care, they're a cohort that we know we're going to need support. So that's another type of example where a really early intervention key worker model supporting which is transdisciplinary, that means that one person is the key person that is supporting that child, not a multiple number of practitioners, and the key worker then coordinates and brings in different practitioners, specialist practitioners at that time that they need it. So if the child is peg-fed and needs ongoing support, obviously a speech pathologist would be probably the key person, but there could be someone else who is also on that team. You need to have a physiotherapist making sure that child is being fed safely and positioned safely, etc. So the key worker model is recognised internationally as well as a model, and is already recognised by NDIS through the research that it has done, and also the new best practice guidelines that are going to be released in June this year that have been undertaken by the Department of Social Services is also going to highlight that the key worker model is, as well as best practice, is an effective way of ensuring local care. So I think that really fits with the Australian community, but picks up on some of the international learning.
And that just feeds into my second question, which is you raise in your submission also that one of the pressures on workforce demand is this issue of the overemphasis on therapists from the NDIS. How do we deal with that issue? Do you have any view on that?
Again, the key worker model as an evidence-based practice model is the solution to that space. The idea that I think currently under the NDIS, the thing is that it's a medicalised approach. And some of the learnings that we can learn from those other two, especially if I can add to that, is they're family-centred and they're strength-based and individualised about the family's outcomes and goals and needs as well, rather than just the child's disability that may need a skill set developed. They're it's a social and emotional model of support rather than a medicalised clinical approach to fixing a child.
So is it about building that relationship first with that key worker and then, if needed, bringing in those other skill sets through that person?
So the key worker model is all about the right person at the right time for the right outcome. And so instead of having 4 or 5 children therapists in your world, you'll have one person that you're connected with who says, we need an OT to come and work on this functional skill development, or give us strategies to work on that, or a speech for peg feeding or communication, because there's a lot more to language development than just speaking. There's other ways of communicating. So it's about that key worker understanding what's the right person to bring in at the right time, at the right developmental stage of that child, especially in early childhood ages and stages. The developmental stages are huge. And at the right time bringing the right person in, rather than going, let's get everyone in on this at the moment, Yeah, as a father of a child with a disability, we had a key worker. If I can speak to my personal experience, we had a key worker from the very start, and that person helped us navigate the ages and stages and developmental stages of our child, and said, you don't actually need a speech pathologist at 0. You know, child's not speaking, and they're not speaking until, you know, about 12 months. They should be starting to do this and that and the next thing. So we didn't need someone straight away. Yeah, I think in the current model of NDIS, the push is to get your therapist now. So you can.
It's almost like it's to find a reason to then qualify for the NDIS rather than fixing the problem.
Yeah.
With early intervention.
Early intervention can solve a lot of those over-therapized models that currently exist under the NDIS. Yeah.
Can I suggest another model as well, which is a best practice model? It's not a model; it's a practice rather, and that's capacity building. There, prior to under ADDIC funding and sometimes through grant funding, there is options to be able to do the evidence-based training packages for families. As an example, because I'm a speech pathologist, I will give those examples. The Hannon programs that have been, widely used across Australia. There's a program called It Takes Two to Talk, More Than Words, Target Word, and also Talkability, where families do a training package for training for a block of, say, 10 to 12 weeks. It's very individualised to them. We do video feedback. And those parents learn strategies that they can use always, every day, whatever they're doing, all across the day. And they don't need to have therapists coming in because they're really capacity building themselves to be effective communicators. We've been running Target Word through our Strong Pathways funding, and we're getting, within a very short period of time, sometimes 400% increase in the number of words that children are saying, and they're just kicked off on the right pathways. The ones that don't still improve, the ones that don't improve at that rate still improve, but they are the ones that actually are the ones that really need speech pathology support. So you really very quickly moving and doing a really cost-effective intervention support that makes significant differences for a long time, but also is efficient, effective, and also really empowering families.
Thanks.
Because we're talking about some progress initiatives, so it's been touched on earlier this morning, the Early Childhood Intervention Coordinator Program, the ECICP. Could you elaborate a little bit more on what that program was and where it's sort of operating informally now?
Yes, there are some remnants of that existing. So Early Ed was actually managing the funding for the local ECICP group, so I have good knowledge of that myself. So that's Early Childhood Intervention Coordinator Program. And what it would do is just a small bucket of money that would pay for the administration of being able to bring people together to be able to meet and network those people that are working with children with a disability and to really connect with each other. So we are now doing that online. We started doing that through COVID, and now everybody knows that you'll get greater turn up at meetings if there are if it's online. But it really keeps the community informed. There isn't. There are so many community networks that are out there, but this one is really targeted to connecting people that are supporting children with a disability either in their preschool, in the early childhood services. It can include the partners that are supporting the community as well. Otherwise, we just don't know what's going on in the community unless that happens. So it's a really valuable support. But these things are hard to run. It's all done on goodwill, and the funding that came from the ECICP program really kept it alive, but also collected some really good data about how effective it was as well. And one thing it also did, I was involved with one in the Western Sydney as well. It would also cover the costs of maybe running a community awareness program or developing a resource for the community as well. None of those things are happening anymore because there isn't that kind of connection and support where you can get together and have those conversations and put time into developing resources and supports.
Thank you. any questions from...
I've just got one,
Ms.
if that's
Payne?
okay. Mr. Usher, you spoke about the fact that your organisation covers from the Tweed down to the Central Coast, I believe, and that you've got some experience, obviously, in running some of those care organisations. You also spoke about how the NDIS has seen, I guess, a deterioration in some of the coordination and the services that are available. Could you, I guess, provide some insight as to the workforce shortages that you speak about in your submission? Do you think that it's partly due to the NDIS and the wages that are available through the funding packages that organisations can attract through providing those NDIS services that are meaning that organisations like yours are struggling to get that cohesive and well-trained workforce that's prepared to spend a number of years in a service, not just sort of use it transiently and then looking for something else?
That's another inquiry altogether. So I think on that space, I'll try and answer that in a short way. In our submission, we've placed that I don't think there is a workforce shortage or a skill set shortage within New South Wales or Australia. It's just the way that the market has developed under the NDIS to actually
pull people out of your services.
Pull people out of best practice.
Yep.
Early childhood best practice. So it's early childhood intervention is very different to an adult-centric support system. So the NDIS is developed around adult-centric supports, where you may need a therapy for an hour. You may need, and that may need to go on for a number of weeks. Early childhood is very different in it's focused on the ages and stages and developmental outcomes of a child, which operate very differently. And so, I think back to my time with with my daughter, there were times where our key worker would sit with us for 3 to 4 hours in a day to look at the situations, to look at the circumstances, to look at how she was interacting with other family members and all of that sort of stuff, and get a full picture of how our child was coping in a day. And then she would be able to implement strategies. We can't do that now, because that would mean that there's 5 hours taken out of a child's package, under the NDIS, which, and a family looks at that and goes, oh, that's a whole lot of money, whereas before they never saw the money side of that, even though there was money attached to that, employment and all that sort of stuff, they never saw that. So they never actually questioned whether or not that was relevant or needed or that the support was in place. So early childhood intervention is very different in its deliverables and its outcomes and its approaches to support children and families. It's a family-centred approach, where you'll need to spend that time with the family to actually understand the outcomes that are needed for that particular thing. And a lot of children become very good, and families become very good at masking behaviours. And I know if I'm sitting in front of this person or these couple of people, I have to mask, I have to behave this way. Mm-hmm. Whereas if they don't have that, if they go into a clinic, again, another challenge. You go into a clinic as a family, they're working on a piece of equipment that's $20,000 that you can't use in your own home. Whereas our key worker came to our home, looked at what was in our space, looked at the games, the readers, all of that sort of stuff, and went, here, use this to build that skill level. Use this to learn communication supports. So they were looking at where our family lived, learned and played, and in those environments, and were able to provide the supports that we needed without extra cost of this piece of equipment, that piece of equipment, and all that sort of stuff. So it was more of a social and emotional and living support rather than a clinical-based, medicalised support for outcomes.
Yep.
So the NDIS for me I think there's great advantages to the NDIS in an adult-centric model. From an early childhood intervention perspective, it has eroded best practice of early childhood intervention to an hourly-based money outcome.
Yep.
Early childhood intervention was always holistic and family focused. Now it's become focused on a child for an hour of therapy, or an hour of this or an hour of that, and families may not look at they don't use the package to look at how can I build our family network, our informal networks, because the funding is constricted to that individual, and so they won't, or they become very wary in using services outside of that child's skill development. But that's not necessarily the best way of supporting that child or the family to get the best outcome that you may need, if that answers the question effectively.
It
Can I
does.
also comment that just highlight the fact that we don't work in clinic rooms. We are out in the community. We drive. We go to the preschool. We spend time with the early childhood educators, supporting them to know how to support their child in that centre so that they're included, but also learning and also becoming a fully participating child in that community. Those things cost, but they also, they're not really attractive if you prefer to just live in, work in your office. So our approach is very different. And also, I really liked your point about building capacity and knowledge yourself as a professional. Early childhood intervention is almost another discipline in itself. You need to know, when you come out of uni, you really just know the technical stuff. And actually, often you don't know very much about disability either. But you also need to learn how to capacity build families and understand how to it's really about adult education and supporting, and then delivering supports in a way that help the family learn just as much as the child learning. If the family doesn't learn, the child's actually not going to really progress at all. So I really value your comment about the professional skills that are required, and that you don't get them if you sitting, you're not really out in the community or in an organisation that's really fostering that learning. And we're all registered providers, so we're actually obliged to supervise and train adequately and provide practitioners that can do their work. That's one of the benefits, one of the benefits to registration being provided, being essential for early childhood intervention services.
I guess it's always a concern of mine that people treat some of these roles as transient or until I get to another level, and instead of actually staying and working and building that capacity within the role to then provide a better service, because ultimately it means that you're spending a lot of your time training new staff to then have them move on.
Oh,
and
yes.
It's not the best use of your time. It doesn't mean that culprit knowledge is retained within the staff, and so I always have concerns about that. Just one thing I wanted to address before I hand back over. Mr. Usher, you said that you didn't believe that there was a workforce issue. It's just that, is it the case then that, I guess, depending on where you live and what services might be available in an area, some are well staffed and some of that workforce needs to be redistributed to ensure that we have a better outcome when we're looking at these matters, particularly sort of in rural and regional areas where there might be a lot of one thing, but we don't have that spread to cover all of the areas that we need to address of a child's development.
I think the short answer to that one is that the NDIS is actually, in the market that the NDIS has created, has allowed allowed a lot of sole traders to come into the space and pick and choose who they support and take easy cases over complex cases. And so a lot of the complex cases that are then, it's up to our community organisations generally to take that, because we're experienced in that space, and so they don't have to take clients if they don't want to, and they don't have to take complex cases, and they don't have to take those ones that require extra thought or space. So the transient. There is a lot of that. The NDIS market has created a lot of transients for us because of that, the ease to be able to move into your own independent service provision. You don't have to be registered. You don't have to follow some of the things that other NDIS registered providers have to follow. And in early childhood intervention, in some instances, there's actually no qualification that's actually outlined specifically to do a key worker role. The key worker role best practice model from ours is an early childhood teacher or an allied health professional in some way, shape or form that has actual training in that space. And we've seen under NDIS a lot of people come into that space who aren't skilled or aren't qualified and take money out of packages that and not deliver services, you know. So there's a whole lot of things on registration on that front that I think needs to be addressed from an NDIS perspective. But the NDIS market that has been created has allowed a lot of free space and a lot of, and you don't have to do early childhood intervention under a best practice model, you know, which is what's eroded the space a lot more.
I think being able to really fund properly the travelling to the communities, whether that be by road or from a centre that you're not that far from, but also sending teams out rurally as well has been something that's often been done, and it's certainly been done in health positions. And honestly, with the technology we have, it's actually really convenient for families to have a telepractice conference, and for you to watch a child on a video and be able to support them, because you're actually not in the room. They behave completely different, so you get a much better idea of what's going on. And that parent can talk to you whenever they need to, instead of waiting for 2 weeks before you have my next organised appointment. And we can get really rapid change, and it's a much more cost-effective way of working. So I guess we're kind of saying the workforce is there, but the problem is it's just not being used very well and effectively, because we've been nudged into this clinical model, medical model, rather than a social capacity building model.
Thank you very much.
Mr. Martin, and then Mr. Deadam.
Thank you, Chair. Just want to go back to parent and peer capacity building and support. Is it fair to say that under the NDIS model that that's not valued?
Yeah. It's not a funded service.
Yeah.
So if we want to do that, we have to employ someone to cover the cost of it. And there's an organisation, Plumtree, that's been running the Now and Next program for a really long time. That they developed that through an ILC grant. I think that's nearly running out of funding, and but they've been able to kind of come up with a package that families could purchase, but there's rules about who you can employ under particular funding, so it's got to be done in a way where it does comply with the guidelines. But parents know, as you pointed out, very, very clearly with your examples, parents are really a vital way of helping, helping a family understand what the journey is like, and supporting them with things that, as a therapist, I certainly wouldn't know how to support them with.
Thank you. Mr. Usher, do you have anything to add?
Again, the NDIS has not provisioned for the parent or peer support in any way, shape or form. And I think it's a critical support that's needed in this space, especially for early childhood intervention. As a parent, there's a whole lot of things you have to deal with that you weren't aware of when your child's diagnosed with a disability, and not being able to connect with other parents. When under the funding that we had previous to when my daughter was, we were able to connect with. There was parent meetings. There was things that was available to us. We were able to go and meet with families and see that the families that are further down the track than us, there is a way out. There is a future. There is a good sense of hope that our children can be successful and achieve great things. Now under the funding models, we don't. That has eroded significantly because it's about the child and getting the child on track and developing the skill of the child, rather than saying, hey, as a parent, there's emotional things that you're facing. There's a whole lot of stresses and strains as a parent that you need to talk to. You need to talk out, and that's part of best practice. It's a family-centred, parent-based child capacity building. All of those sort of avenues within an early childhood best practice system supports the whole family. And provides for that.
If you learn in a group, and you're a parent with a child with a disability, you're wrapped around not just by your team, but you're wrapped around by all the other parents in that group. And you're learning multiple things in the room at one time. You're learning how other people engage with the child. You're learning what my future might look like. And you can share your what you've learned as well and feel empowered. That doesn't happen anymore, because families don't value group programs. They just want to have individual one-to-one services. Group learning is a powerful learning tool that we have lost as an example, just with the way the money's set out, and also the kind of focus on this kind of medical individual approach.
Thank you very much. I'm conscious of time.
Yeah, look, I've got a question just about, I think you talked about this issue around travel. There seems to be, your emphasis in your submission is around funding non-profits to deliver these supports, particularly in rural and remote, where there's great distances to be traversed. There seems to have been a tendency to concentrate funding in larger organisations, and they then tend to centralise the employment and dispatch workers to remote rather than having workers in situ. And I wonder whether there's what we need to do to try and address that particular issue around service delivery, which obviously contributes to there being an absence of services, in particular in regional and remote areas.
I guess we've got to attract people to work out there. And that's why people are working in their offices, in their clinic rooms, because it's much more comfortable than getting in the car and driving for miles. It's lonely. It's isolated work that we're doing now. And that's why we also really need really strong connection with our workers to make them feel supported and connected to the services that they're working for. So I think it is around finding ways to attract people to work in rural areas, and I think this is probably not just an issue for early childhood intervention providers, but across across all the services. Working rurally has its own challenges. But have you got anything more to say on that?
Look, and I think it's about using technology in a smarter way. I don't think under a best practice model we don't need weekly therapy appointments. So there may be an opportunity to go out to a regional or remote area, meet face to face, have a look at, spend a week out there and look at the child's development and all of that sort of stuff, and then from there set up action plans and supports through a telehealth or other support network, other support service delivery options, using what's currently in space. So early childhood intervention, for example, we use a lot of, we talk about live, learn and play environments. So where the child is actually, if they're in an early childhood education centre, how do we upskill the early childhood provider in that region to actually ensure that that child is included and has the supports that they needed in that environment, without needing our service to be on their doorstep every day, or in the family home, or in the community, community sports or community dance, extracurricular activities that a child may do. You don't need to be in them every single day. You may be able to support them through telehealth practices and through written strategies and that sort of stuff. So there is scope to expand service into those regional and rural with a different approach. Without having to have someone on the ground. But the challenge with on the ground right now is under the NDIS funding is you can only charge per hour of service that you deliver. If it was a block funded support where we had someone out there and they're not tied to a KPI of delivering hourly supports and they were funded to be in that community to support that community, it's a completely different approach and a completely different manageable, economically viable.
And if we're using foundational supports and we're getting in there early, the amount of work we're going to have to do to support that child is going to be less, because we've got in early and we've given them the supports, and we're supporting also the community around them. We're supporting the playgroup leader to be included and the parent to be capacity built. If you put in foundational supports that are not just, and you do it early and you do it in a way that capacity builds the community, the family, everybody that's working with that child, you're going to get really rapid outcomes, and you're going to basically in the long term require less supports in the long term.
Because a child doesn't live in a clinic. A child lives in its community. So capacity building its community, its informal supports, its formal supports, you're going to get greater outcomes, you're going to get much better response long term. And
also, I'm just thinking about capacity building the centre. You don't want to be capacity building one person. You need to be capacity building the whole centre, but to be able to tailor their program individually to their child, but also support that child to be included in that service effectively as well. So it's a very broad support.
Thank you very much. And unfortunately, our time has run out. I just wanted to conclude by thanking you and please, on behalf of the committee, also thank all your organisations for the great work you do working with families and young people and children as well. So thank you for coming today.
So much for your interest.
want to kick off?
Yeah, sure.
I'm just marking at getting the back end. You can come forward. Have we got Sarah? I think Sarah Mitchell is going to be joining. Yes, that's right. Yeah. Yeah. Yeah, so I'm not sure if she's waiting there.
I'll wait till she's...
Thank you very much, everyone, for coming today. As you're aware, before we commence, we'll need to ask you to state your name, your position, and also swear either the oath or take the affirmation, the words of which I understand are in front of you. And we'll start with Ms. Williams.
Hi, I'm Maddie Williams. I'm the Policy and Research Manager at the Local Community Services Association. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
My name is Can Yashmud. I am the Chief Executive Officer of the Local Community Services Association. I solemnly and sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth.
My name is Tyrene Vergara and I'm the Acting President of the Local Community Services Association, and I'm also the CEO at the Parks Community Network. I swear that the evidence now about to be given by me shall be the truth, the whole truth and nothing but the truth. So help me God.
Thank you very much. Before we commence with questions, would you like to make an opening statement?
Yes, I will make an opening statement on behalf of the three of us. Thank you, Chair and committee members, for inviting us here today. I'm Can Yashmud, the CEO of LCSA, and besides me here today is Maddie Williams, LCSA's Research and Policy Manager, and Tyrene Vergara, LCSA's Acting President. Tyrene is also the CEO of the Parks Community Network in Southwest Sydney and a parent of a child with autism, and she has generously agreed to share her insights from all of these perspectives today. LCSA is the peak body and membership organisation for neighbourhood and community centres in New South Wales, and we advocate for the practice of community development. Neighbourhood and community centres are a vital part of the social fabric of New South Wales. These locally governed, secular community organisations are trusted access points for support, serving over 72,000 people each week across 175 centres in all corners of the state. We believe there is a great potential to link up the work of the disability sector with the neighbourhood centre sector to support children with developmental concerns, disabilities or additional needs. Neighbourhood centres already play a critical early intervention role for children with additional needs and their families. Neighbourhood centres frequently engage with families long before a diagnosis is made or formal supports are in place. They provide what is often described as a no wrong door approach, helping families navigate complex systems and access essential supports in a safe, welcoming environment. Despite this essential work, neighbourhood centres remain underfunded and under-recognised within broader systems of care and support. Programs such as the Targeted Early Intervention Scheme with child protection within the child protection system, while invaluable, are overstretched and deeply underfunded, with no increase on the horizon to meet ever-increasing demands. On the current NDIS trajectory, there are only 14% of Australians with a disability that have an NDIS plan, and where those plans are already being cut before foundational supports have been established, we anticipate the pressures on mainstream organizations like neighborhood centers will only increase. Our recommendations to this inquiry are: 1, invest in neighborhood centers in local communities through foundational supports. 2, triple the overall targeted early intervention funding. 3, harmonize and de-identify data of children with disabilities across the social services spectrum for better visibility of needs and to drive policy and investment. And 4, radically overhaul the New South Wales child protection system to appropriately resource and make better use of the effective early intervention end of the spectrum in line with DCJ's own internal reviews. There is a pressing need for more coordinated investment and systemic reform to better support kids with disabilities and their families. With appropriate foundational support, better data visibility, and a genuine commitment to prevention, neighborhood centers could do even more to reduce demand on the crisis end of the child protection and disability services. We look forward to answering any questions that you may have today. Thank you.
Thank you very much. We've resolved as a committee to have free-flowing questions, so no time sort of allocated to individual members. But I will let you know we do have 2 members online as well. Sarah Mitchell, who is with the National Party, and we also have Mr. Mark Buttigieg from the Labor Party. But I'll start with questions from Mr. DeAdam.
Thanks for your appearance today. I thought I'd start with just a more open question around what you think the role of community development is in relation to the provision of foundational supports.
Thank you, Mr. Dadham, for your question. Community development can broadly be described as a practice. There are many definitions out there, also a process or a framework. But ultimately it comes down to the grassroots level support mechanism. It means that community development is a practice where you do things with people rather than for or to people. And neighborhood centers support communities to flourish by fostering independence, focusing on self-determination, and giving people the agency to actually deal with their issues to the best of their capability. I think the main distinction is always between community development and service delivery, and we just want to highlight that generally speaking in the human services space there is a strong view that service delivery solutions are the right solutions, and we don't dismiss that. We think service delivery and community development must go hand in hand, and the idea is not so much about what is wrong with the person, what is it that needs fixing, but it's about creating an environment where protective factors are increased and the risk factors are decreased. And that is not achieved by a direct intervention only. It needs a wraparound approach so that the person who is requiring services actually is not only seen as an individual, but also a person that has families, friends, school communities, and so on, where you have to think about, well, in what kind of environment do they flourish, and how can they best navigate the issues that affect their lives. And the other aspect to our arguments is the notion of social infrastructure. So when we talk about neighborhood and community centers, we make that distinction between social infrastructure and service delivery. Community development happens to be the currency that actually drives those two. A lot of neighborhood centers receive a great variety of funding sources, including TEI. Some are NDIS providers, some are childcare providers, aged care, Meals on Wheels, you name it. There is a connection to different parts of the sector. We see that as a service delivery function, and that can be done, as I explained, with a community development mindset and framework. But the social infrastructure element is probably the one where we believe we have a value to add to whatever foundational supports in the future will look like, because you have an existing network of over 170 organizations that share broadly the community development principles as their organizational foundation and their values, and ideally in their practice. So that social infrastructure element, I think, is something that we highlight as a potential opportunity to just draw on when it comes to the dissemination of foundational support, funding and investments in the future.
Neighbourhood centres are place-based organisations. Why do you think a place-based focus is critical in terms of provision of support for disabled people?
So neighbourhood and community centres can make significant contributions to foundational supports for children with disability in ways that complement the NDIS. So NDIS packages are centred around the individual supports they require. Neighbourhood centres, through the Targeted Earlier Intervention Program, other programs and community development projects, work through the lens of family and community. In our sector, we often say that it takes a village to raise a child, but who raises the village? Supporting the families of children with a disability and strengthening the family unit's connection to their communities is essential work in helping these children and families thrive. And it should reduce more intensive interactions with the child protection system and also interactions down the track with the youth justice system. Support of the family unit is imperative and often needs to happen before the family will action a medical referral, for example. Given the enormous stigma around some diagnosis in some cultures and lack of understanding of them, some families require many informal discussions with their local neighbourhood centre in order to accept that their child may have a disability and would benefit from further supports. It is common for families to resist medication even when there is a clear case for it and they need to be talked through their concerns. Neighbourhood centres are a natural fit for this role because they work from the point of connection and belonging. People appreciate that staff at these organisations listen to them without judgment. A family might not be ready for what they are referred for, and that's okay. I've got a case study and then my personal experience, just to demonstrate. Yep. So an example, and all the names have been changed to protect the privacy of all people. So an example of this that my centre encountered was with a woman named Sarah. She was a single mother of two, one of whom had developmental delays. She was referred to a parenting program but didn't feel ready to participate. Instead, she attended the Parks Community Network for free school holiday activities. And while the children were playing, Sarah spoke with a support worker over coffee and shared an immediate concern. Her car had broken down, making everyday life and getting her children to school extremely difficult. The centre helped her access a small no-interest loan to cover the car repairs. This practical support eased her stress and improved her children's school attendance. Over time, as trust and connection grew, Sarah chose to join the parenting program that she had initially declined. Sarah's story highlights how meeting families with empathy, practical supports, and no judgment can build trust and lead to meaningful long-term engagement. So while targeted foundational supports might include or involve getting parents to engage in a parenting program, the work to get parents to accept that way forward is invisible and unrecognised. That is why government needs to make this work visible and include it as an essential component in designing general as well as targeted foundational supports. So an asset of neighbourhood centres that shouldn't be underestimated is the lived experience of staff and volunteers. So there are many workers and volunteers in neighbourhood centres that have a disability themselves or who have children and loved ones with a disability. So I am the mother of an 8-year-old daughter diagnosed with autism spectrum disorder at 2.5 years old. Our NDIS approval process took about 8 months, which I understand is faster than many other families experience. Because I advocated strongly for my daughter, she received an adequate NDIS package that covered the intensive therapies she required. However, accessing quality therapy remained a major challenge. We had to travel over 45 minutes to reach her ABA therapy centre and speech therapy services due to the limited availability in Fairfield in southwestern Sydney and surrounding areas. The initial diagnosis costed almost $3,000, a significant expense, but one I believe was essential to secure a strong NDIS package. So while waiting for the NDIS approval, I had to withdraw approximately $80,000 from my superannuation to pay for ABA therapies and travel to Lane Cove 3 times per week, as these therapies were mostly accessible to more affluent families. Through attending ABA therapy, I met many families from northern Sydney suburbs whose children had formal diagnosis and received NDIS packages up to 3 times larger than those of families from less resourced areas like those my organisation supports. This stark disparity highlights ongoing inequities in access to diagnosis, funding and services based on geography and socioeconomic status.
Thanks. I've just got one more question, which is your submission talks about the importance of data collection and data sharing. I wonder whether you could sort of elaborate on the kind of data that is being collected at Neighbourhood Centre or the kind of data that you think would be useful if given access to on a de-identified basis.
Yeah, so I'm happy to talk a little bit more about where we think the gap is and where the opportunity is. And then Tyrene, you might want to just relay a little bit about what's available in DEX, but also other data sets that you have. So we think that better visibility of children with a disability in child protection data is important because without it we don't know how many of the kids that are captured in the care to custody pipeline in New South Wales and indeed across the country have a disability. And so what I mean by that is that there is a strong onflow of children in the child protection system who go on to interact with the youth justice system. So a New South Wales Bureau of Crime Statistics and Research Boxer study found that in children aged 10 to 13 in 2023 with a court appearance, 82% had been the subject of a ROSH report, which is risk of significant harm, and 60% of children received 10 or more ROSH reports. So these are the first and third highest correlations in the study. And given this, any efforts to reduce the number of children in the intensive end of child protection through early intervention should be a priority for the government. And in 2023, Boxer published a longitudinal study of offending by young people with disability from 97 to the end of 2000 and found that young people with disability are overrepresented in the youth justice system. So young people with a disability made up just 3.5% of all young people in the study group, but they made up 7.7% of all young people with an offence and 17.4% of those with an episode in youth detention. The Boxer research director, Dr. Susan Poynton, stated that factors such as age of initial engagement with disability-related services, remoteness of residence, and frequency of child protection contact were strongly associated with the likelihood of a young person with a disability having criminal justice contact before the age of 18. And so we think that the missing data link is how many children with a ROSH report have a disability, which is why in its submission to this inquiry, we call for de-identified data collection and visibility of children with a disability in targeted earlier intervention, otherwise known as TEI, and in all parts of child protection. So DCJ in its own internal reviews acknowledges the integral role of early intervention in reducing the number of children in foster care and recommends a significant investment in it. So part of such an investment, which is still not promised or delivered, must include the identification of children with a disability in the system and ensure families have adequate access to disability support and inclusion services. And the provision of well-targeted and well-resourced foundational supports for children in TEI programming could help to drive down contact with the criminal justice system and ensure a good life for those children and their families. And Tyrene, did you want to talk a little bit about DEX and the limitations?
Yeah, that's right. So currently DEX, basically there's one question that would identify a child as having a disability, and it says disability yes, no. Which is problematic, obviously, particularly in southwestern Sydney, with not many young children with a formal diagnosis. So basically, developmental delays will not be counted in the mix. And even when a diagnosis exists, like families will say no, no disability. So obviously, we need to ask further questions in that regard. And organisations are collecting that additional information, but it's not actually being collected by DCJ. So they're not getting the narrative that goes behind. Yeah.
For the record, what's DEX, by the way?
Oh, the data exchange. So it's a platform that most DSS funded programs use. Now it's been acquired by DCJ as the data collection platform for the targeted earlier intervention program.
And before I hand over to Mr. Marlin, just in relation to that data collection, when you said DCJ is not collecting it, is it because of the software, or is it because of so they just need to upgrade software to allow to capture more data?
That's right. So I think initially when DCJ, as part of the reforms in 2020 to the Targeted Earlier Intervention Program, did not want to make a big investment in regards to customisation of the data exchange. So most of the changes that were made, and I know this because we use it for other programs in my organisation, so we're more cosmetic rather than sort of like took most of the questions on the data exchange. Thank you.
And I think, sorry, if I may just quickly add to that, Mr. Martin. My understanding is that DEX is a program that actually sits with the federal government, the Department of Social Services. So for any changes to be made, it is actually almost like a commissioning of changes from DCJ to DSS, which then always begs the question of, how much investment needs to go out of DCJ funds into federal kind of processes to update that program. So it is very, very rigid, and changes are not made easily. I mean, that's I think the feedback we were getting. I don't think it is necessarily because DCJ doesn't see the value or doesn't want to, but there is a process and a cost involved with that.
So Mr. Martin and then Ms. Mitchell.
Thank you, Chair, and thank you all for being here today. I just want to start, Ms. Vergara. You touched a few times, once in your opening statement and once in an answer just given a few minutes ago, about the reluctance or resistance of parents to treat or refer to their child as disabled. Could you expand a bit more on the dynamics of that, how that comes to be, and also how you overcome that?
Yes, with a lot of empathy we overcome it, and trust over time and interactions, lots of informal, and that's what it is. So it's those soft entry points to kind of the more targeted support's really important. So some of the cultures I came to Australia in 1988. I've always lived in the Fairfield local government area, so very diverse. And some of the cultures in my area, there's a lot of stigma and shame around additional needs and disability. And so many of the families come to us because we're a generalist service. So they don't want their neighbours and their family and friends to know that their child has additional needs. And often when they do accept the supports, it's almost like, okay, you're going to fix them and then they're going to be normal. So, so it's a very long process. And with the limited resources that we have in the Targeted Earlier Intervention Program, it's very tricky for us to support the families for months, if not years, before they embrace supports and diagnosis. So advocacy is crucial for my community, I must say. Like for us to do the advocacy on behalf of those children, really, and the families.
And when you say advocacy, so it's a larger education piece, so that people who haven't ever had to give much thought to the issue or subject of disability, all of a sudden they're confronted with perhaps being told or suggested that there's an issue there.
Yes, absolutely. And it's even like a community events, like it's even providing, like a sensory room at a community event. Like the parents might say, oh, no, my children's not going into the sensory room because like the friends are going to know that they, they're getting overwhelmed by the noise at the event and things like that. So yes, it's it's about normalising, I guess, or accepting. I don't know if normalising is the right word, but
so we all have a job to break the stigma down.
Yeah, that's right.
Alrighty, I'm conscious of time and other members.
Thank you. Mrs. Mitchell. We also have another member that's online as well, Mr. Murphy, who I forgot to mention before, but Mrs. Mitchell.
Thank you, Chair. Can you hear me okay?
Yes.
Excellent. Thank you all for coming in, and particularly Ms. Vergara, thank you for sharing your personal experience. I just have two questions. The first picks up a little bit on what you said about access to services coming from, sort of southwestern Sydney into the northern part of the city. But I was also interested from a regional perspective, because I'm obviously a member that lives outside of Sydney. What are you finding from maybe your services outside of Sydney or your centres in terms of that access to both diagnosis and support for families who might go to your centres in regional areas?
Well, I might answer that, Ms. Mitchell, if that's okay.
Yeah, of course. Yeah.
It is interesting to note that neighbourhood centres in more regional and rural areas more often than not play a fairly prominent role in their community and in the community services sector. So that is the case somewhere in the metropolitan area as well. But when you come to areas like Cowra, for instance, or Dubbo, or where neighbourhood centres are in fact a very essential part and very much embedded in the community. A lot of them would be also NDIS providers, and they bridge that gap between being a service provider and being a place-based organisation that has a trusted and respectful relationship with their community. I think makes them a good point of access to the service system. So while I can't give you any forensic evidence, our experience has certainly been that organizations like Cowra neighborhood centers are very well respected and provide that often referred to as a soft entry point. And I think that's what Tyreen was saying as well, is that neighborhood centers are place-based organizations where people are not judged. And those who don't necessarily want to be identified as a case, in inverted commas, or as a client, they are looking for a place where they just can find the initial point of contact. And that emerges, more often than not, that emerges from, in smaller and rural communities in particular, from the notion of trust. So if I don't know if that is a good answer, but I think that
that's good. Yeah.
That from our point of view, that is the whole value proposition of community development as an approach, right? That there is a place where people know they won't be judged as they enter the door, and that is often a contrast to the service delivery mindset, where the question is asked, what's wrong with you and how can we help you fix the problem? If that is the posture, and there is a kind of a glass perspective kind of reception area, it's very hard to break down that initial barrier. Whereas if you do it in a more community setting or have that existing relationship, then conversations can be had in a much more informal and supportive manner.
Yeah. Thank you. Oh,
Can I add
please.
just something?
Please.
Just in regards, I think you mentioned assessments and so forth. It's very complicated because, as I said, like mentioned before, like it takes months on end to actually try and encourage your family to accept referrals and supports. And then when we try and refer, there are very limited places that we can refer for supports or wait times. And due to, like some of the vulnerabilities of our community, then they're waiting for a diagnosis for a very long periods of time. We are also no interest loans provider, and many of those families, once they are open to embrace therapies and so forth, then they kind of find that they need the diagnosis in order to, it opens opportunities or, bigger packages, NDIS packages and that. And it's really sad that that's the case, but that's how it's turned out, how it's been rolled out. And then they come for a no interest loan to actually pay for the assessments. That costs $2,000, and that's probably another thing, like for an autism or a ADHD like assessments to cost $2,000, in 2025, like it's not fair, really. So I guess if that could be looked at somehow, that would be really useful and helpful for our communities.
Thank you. Chair, could I Do I have time for one more?
Yes, that's fine.
Okay. Thank you. I was really interested in your submission when you talked about the example in Leeds. I wasn't aware of that, and so it's good to be able to look at what other jurisdictions are doing. I just wanted to ask, in terms of the siloed issues that you mentioned in relation to data, one thing that I have found over the years, and it's not a reflection on anyone within the public service, but sometimes getting agencies to work together can be quite the challenge, despite people being well-intentioned. I'm wondering, and I'm happy if you need to take it on notice, but I'm wondering in terms of what they did in the UK, were there changes to sort of the public service and departmental arrangements as well to streamline the processes, and is that something that we could be looking at as well?
Most definitely. What we have learned from Leeds, and you would have seen the child protection bow tie as an analogy as well, is the idea that child protection in this context is everyone's business. And that was something that was implemented by the public service from the top down. They aligned all programs within the child protection system under the same outcomes framework. So what we have in New South Wales currently is probably the best example is the Human Services Outcomes Framework. While it sits there in program guidelines and so on, I think there is not a concerted effort to make sure that all human services actually try to contribute to the same outcomes. And the outcomes that they had in Leeds were things like all children are healthy, children are ready for school, all children can reach their potential. So there was 5 domains that were very plain English and very clearly identifying that it is about all children. So that is the nice thing about the Leeds example is they took a community development framework to implement reform and did that by articulating outcomes that matter for all children. And that way, not only was it then funded programs and bureaucracy, but even businesses and the media and philanthropy. Everyone could actually come together and work towards the same outcomes. I mean, they call themselves child-friendly Leeds, and they wanted to be the child-friendliest city in the world. And I think there's nothing stopping Parliament or New South Wales Public Service to actually have similar ambitions. Why shouldn't we be the state that is the child-friendliest state in the world? And I think to dream big sometimes, I think, can make some significant changes. But it needs to be a strength-based approach, not that stigmatizes or identifies what is wrong with children or with families or communities, but making sure that everyone can contribute towards indicators and an outcomes framework that is actually strength-based and not just counting widgets and making sure that we kind of filled the quotas. So I think that is, if you would like us to provide you with more information, more than happy to take that on notice. But I think from a conceptual point of view, combining community development with an outcomes framework that is strength-based and aligning all programs to contribute to that is probably the key. And with the bow tie analogy, I just wanted to say that foundational supports, especially general foundational support, investment into TEI or into any human services should pick up on that point that community strengthening is not just a soft entry point. It's not just the early intervention and prevention space. There is a whole of lifespan situation here that it's not a point in time intervention that we are talking about or a series thereof. As people grow older, as children grow older, their needs change, but their communities don't. The families don't, the carers don't. So there is an ongoing change, and that longitudinal and all-encompassing approach requires investment in the community strengthening as a concept that underpins not just the early intervention prevention, but the whole of child protection and other human services systems.
Can I just add something?
Yeah, of course.
We spoke at the inquiry into loneliness and social isolation a couple of months ago, and we also talked about the UK there when it came to loneliness. So they had created a loneliness ministerial position.
Yeah, I saw that.
Yeah, and they all departments each year have to report against some loneliness outcomes, and it's sort of all on a dedicated website and how they're going with everything, just acknowledging that lonely people are traversing all systems, all parts of life, and children with disabilities or additional needs will also interact with all systems like health and education as well. And so to have a unified approach, perhaps like loneliness, where government departments are at least reporting against common outcomes, like may also be applied.
Thank you. Thanks, Chair.
Thank you. We'll pass to Deputy Chair, Ms Boyd.
Thank you very much, Chair. And hello, apologies, I was stuck in another hearing for a bit, but I have been updated on the evidence so far. Can I just ask, among the families of children with disability that you support, have you had any instances of the sort of NDIS package being decreased with the justification that there's going to be some foundational supports, but they're not available yet?
Yes, so we have already, like at the Parks Community Network, we have come across not many, but a few families that have had NDIS packages cut for their child in anticipation of the rollout of the foundational supports, which obviously hasn't happened yet. So yes, and what I do want to say is that a large number of families in our community are not even aware of what foundational supports are. So they've never heard those words, even though they may have a child that attends therapies and an NDIS package. But you also have some that are already seeing the effects of the foundational support. So there's a lot of uncertainty and fear in the community as well as to how it's going to be rolled out, because some families do have existing trauma from the NDIS rollout. So there's concerns whether, like, okay, my child does not have a formal diagnosis. Will they have, will they not have preference around the access to foundational support? So will preference be given to children with a formal diagnosis and so forth? So, yeah, so those families are coming to us to have those conversations already.
Can I ask then, I guess coming out of that, out of your response just then, it reminded me of my own experiences as a mother of children with a disability, where it was almost impossible to know where to go for a diagnosis. It was there was no kind of easy way to find out where early intervention services were or any of those sorts of things. What role does neighbourhood centres play, I guess, in that sort of informal kind of referral sort of service? Is that something where neighbourhood centres can plug the gap?
Yeah, absolutely. So through various services that we offer, so we actually do provide casework under the Targeted Earlier Intervention program. So for families who are struggling. We also receive referrals directly from DCJ for the ROSH reports that are not meeting the threshold. And what we are seeing is an increased number of referrals of families where they are struggling with their parenting because they have a child with additional needs or disability. So we're actually doing that work. And so because they're in denial and there's all the grief and loss that they're experiencing, they're not maybe using the right approach, and so they're being reported basically. And so we have to do this cold calling. They're not even aware of the referral to our service, and but a lot of them do engage with us because they feel that they are being heard and supported, but it takes a very long time, as I mentioned before, to actually get them to a point where they might accept referrals.
So that's great that DCJ, I guess, recognises the benefit of the service that you provide. If they're referring to you, though, does that mean that they're giving you any funding?
So we do receive funding. So under the Targeted Earlier Intervention, the unit costing is very minimal for the casework, and the alternative referral pathway is only happening in southwestern Sydney. So in other districts, only the ones that meet ROSH, the reports that meet the threshold, are the ones that are actually getting a caseworker or referred to an intensive family program. But in southwestern Sydney, there's this alternative referral pathway to TI providers for casework.
Okay. So you get funding, sorry for the silly
Yeah.
question, but so you get funding when it's a referral from DCJ, but if someone comes...
No,
or
we have a contract with DCJ.
Right.
We have a contract, but only in southwestern Western Sydney we actually get direct referrals from DCJ, whereas in other districts most of the referrals are community referrals, self-referrals or from other agencies. Whereas up to 20% currently of our caseloads in family support services are direct referrals from DCJ, which is fantastic.
Yes.
Because otherwise these families would not get any services, so they just get closed at that point. Nobody's looking at them because they're not meeting the threshold of significant harm, risk of significant harm.
I'm just worried about your levels of funding though, in terms of, like, are you getting enough funding then for all of... No, that's what
No, so we're actually doing casework. I can tell you anecdotally as well that we're actually doing casework without any brokerage allowances at the moment. There's no funding for brokerage as such.
Right.
So in more intensive programs that DCJ are funding, there's probably an allowance for that. But whereas as we speak, the funding is not enough to actually cover brokerage.
And am I correct in, I'm sure I read this, maybe in your submission, maybe not, that in New South Wales we're the only state not to provide funding to neighbourhood centres? Is that correct? Like, of course, kind of, base funding?
Yeah, so in terms of core funding, New South Wales is probably the big gap compared to other states. Every jurisdiction has a different kind of arrangement, but there is definitely a recognition that the social infrastructure needs to be invested in. So in New South Wales, I think the historic development has been that neighbourhood centres are an essential part or a key part of the service system and have always been seen as an important partner to receive funding, but that core funding piece has never been addressed or implemented. So yes, the short answer to your question is that yes, but there are a lot of variations when you compare it with other states, because the way that neighbourhood centres and community centres have evolved in New South Wales is different to how they have evolved in settings like in Victoria, for instance, where adult education was one of the key drivers. In Queensland, disaster response was a key driver. And in Tasmania, it's probably the purest kind of community development, social infrastructure funding. But then again, it's a much more compact system with 36 neighbourhood centres, whereas in New South Wales, you're looking at 175 that all over the decades have grown and changed and evolved. So to find that common denominator within the service delivery aspect is fairly difficult. That's why we always talk about TEI, because TEI is, in many regards, funding these grassroots activities that we're talking about, referral, advice, soft entry point, whole of community support, so all the things that benefit foundational supports potentially already are and potentially could more in the future, are effectively funded out of the child protection system. Whereas our argument is that if the social infrastructure element was recognized with core funding in neighbourhood centres, it would take a huge amount of pressure off the child protection system. It would allow TEI funding to be much more targeted at where it is meant to be targeted at, and it would allow local organisations to do that community level initial assessment and support and general foundational support work.
Thank you.
I've just got one question, so I'm mindful of time. Just following on from the TEI funding, which is now being recommissioned and calling, I think it's the Family Connect and Support. You mentioned earlier about overhaul of TEI funding and services in light of the review that's happened. I just want to find out, have you been involved, or is TEI been included in any way with the out-of-home care reforms that are taking place at the moment?
No, I don't think so.
Yeah, no is probably the short answer. I agree. It is interesting that in the out-of-home care review, there is definitely a recognition that early intervention and prevention should play a more prominent role in reforming the child protection system across the board. But the review and the reform attempt, I think, is very much focusing on a very pointy end of the system where there are some dysfunctionalities, and obviously some good work can be done in that space. LCSA's position is that it is probably best summarized in the bow tie, but our position is that investing into community strengthening and community level support and into place-based organizations is a way of not only allowing early intervention and prevention, but also to create an environment where people that come out of the system or come down the system, like that they need to be reintegrated into a community that is strong and that is resilient. So we would like, as LCSA, we would certainly like to have TEI, and in particular the notion of prevention to be reintroduced into a child protection system reform process. Prevention has certainly been lost out of the policy discussion, which is a real shame.
And is it fair to say that you advocate that TEI, out-of-home carers, should be one bucket, and foundational disability support should be a separate, and but not in any way tapping into the same when it comes to funding?
Look, I think there is definitely a potential for foundational supports to have a standalone function that is not tied to TEI, but I also believe that there is an overlap that is currently being investigated, I believe, by DCJ and the Minister towards looking at maybe finding ways of having foundational support mechanisms actually tie in with TEI outcomes. Mm-hmm. From LCSA's perspective, we look at it in three different categories. One is foundational supports could play an important role in bolstering TEI and recognizing some of the work that's already been in TEI and freeing up the resource within TEI by increasing the funding pool, through alignment or through a second program that sits alongside it, however that looked like. Then we think the second one is that foundational support independently and autonomously as a program or as a policy area could be invested into neighborhood and community centers as a network, as a social infrastructure network. Back to the point I was making to Ms. Boyd, that there is a social infrastructure piece there. And the third element is that we also think that community development at large is not just tied to child protection. So we've got 1, attached to TEI, 2, the core funding argument, and 3, this idea that foundational support, how it looks like, needs to have a strong community development component, which is not currently funded appropriately anyway.
Yeah. All right. Thank you very much. Unfortunately, our time has expired, but thank you again for coming today. I think there might have been one question taken on notice, and then if there's any supplementary questions, they'll also be sent through to you.
All right.
Thank you.
Thank you very much.
And we'll reconvene at 1:30 for those online. Welcome for the afternoon session. Before we commence, I'll need to ask that you state your name and your position, and also either swear the oath or take the affirmation. I understand the words are in front of you.
Yes.
And we might start with Miss O'Loughlin.
Thank you. So my name is... Do I need to press this on, by the way?
No, that's fine.
Okay.
It's all fixed.
So my name is Gráinne O'Loughlin, and my substantive role is the CEO of Karitani, and today I'm here representing CAFSA Alliance. And I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God. Thank you.
Yes.
Thank you. I'm Dina Petrakis, and my substantive position is CEO of Ethnic Community Services, and I'm here today representing the CAFSA Alliance. And I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thank you very much.
Thank you.
Just so you know, we have obviously members here. The Deputy Chair, Ms Boyd, is on her way. And online we also have Mr Buttigieg and Mr Murphy, who are from the Labor Party, and also Mrs Mitchell from the National Party. And just so you know, we have established that we'll have what we call free-flowing questions, so rather than structured time of allocation. But before we commence, are there any opening statements you would like to make?
Yes.
Wonderful.
We have a little introduction. Thank you. So I'd like to acknowledge that we're on Gadigal land, and I'd like to pay my respect to elders past and present. Good afternoon. The Children and Family Supports Alliance of New South Wales, otherwise known as CAFSA, thanks the members of the inquiry for their consideration of our submission and appreciates having the opportunity to speak before the Legislative Committee on issues of importance to families and children. Today, we represent the views of a collaboration of service providers from mainstream, specialist, community-based and not-for-profit organisations. We collectively work with over 182,000 children and families in New South Wales, including with children with disability. CAFSA member organisations cover a range of services from direct service provision for children with disability to support for parents, families, carers, siblings, and the provision of and development of appropriate resources. We know that individual members of the Alliance have made submissions to this inquiry. Through our Alliance, we are committed to representing the voices of diverse communities across New South Wales, including First Nations, those from culturally and linguistically diverse backgrounds, socio-economically disadvantaged regional, rural and remote communities, and the LGBTIQI community. As providers of services, we are acutely aware of the gaps in foundational supports which limit outcomes for children with disability, their parents, families and carers, and we believe this can be addressed by further investment in and leveraging existing New South Wales and national services to ensure seamless integration of foundational supports in state and national ecosystems. One of the biggest challenges we see is that we work within a large, complex and fragmented ecosystem, which precludes many families from easily navigating, accessing and finding the care they require when they need it and where they need it. Systems and service navigation solutions must be designed and implemented to address this. Foundational supports need to be sustained and culturally appropriate to ensure engagement with parents, families and carers. This will form the basis of an equitable, accessible service model. Lessons learned from our decades-long experience and which are fundamental to the successful implementation of foundational supports include placing the children and families firmly at the centre of all foundational support design and development. How will this be achieved? Firstly, it will involve investment in local and trusted not-for-profit sector which provides access and community-led services to children and families through mechanisms such as relational contracts and longer-term funding contracts. We also must address workforce shortages, which will achieve broader care sector parity and competition across the disability, aged care and early childhood sectors. Secondly, We must recognise that equity is based on the recognition of First Nations called regional and rural families and other cultural communities having universal access to support through culturally safe and appropriate services and supports. Thirdly, development of an integrated care system through a cross-sector approach that includes health, early education, early childhood intervention, child and family, and social services to reduce vertical silo-based service delivery and facilitate easy system and service navigation for families. Finally, investment in evidence-based services and supports aligned to sector-based best practice guidelines, including consideration of past successful programs and commissioning frameworks. This will include identifying current green shoots and emerging programs for families and needing services which are not currently funded, including community-based ECI and parent training. Because we know that well-informed and well-supported families, communities and skilled service providers can and will work together to achieve these outcomes, we are advocating on behalf of the CAFSA Alliance to offer to work with government on foundational supports, design and development. We look forward to future collaboration on strategies that enhance child development, child and family wellbeing outcomes for all children 0 to 9 in New South Wales. Thank you.
Thank you very much. We'll now commence with questions, and we'll start with the Deputy Chair, Ms Boyd.
Thank you very much, Chair, and good afternoon to you. Thank you very much for your submission, for coming in today. In your submission, you speak about the need to prioritise a state-based, block-funded, not-for-profit service model that promotes collaborative, place-based approaches. Can you tell us how that would work with the rollout of foundational supports in an ideal world?
I'm happy to start with that question. So lovely to be here. Thank you, Ms Boyd, for your question. So in terms of when we look at the children, I guess, accessing the NDIS package, there's a certain amount of funding that's attributed to the child and family. And what we're seeing in other parts of the service system, and I work in the health system, is that there's block funding available. And so if we look at an amount of funding going to a service provider, and then determining how that funding is best and most equitably distributed to priority populations and need. I guess what we're seeing is, though, that there are multiple providers that will operate in foundational supports across a very diverse ecosystem. And so you will have health providers, early education providers, disability providers, and it's going to be very difficult to really know where to put the funding so that the child and the parents are central to receiving what they need. And so we would imagine that government will want to do a little bit of a gap analysis around current systems in New South Wales, so what's currently funded through health, what's currently funded through programs like TEI and supported playgroups, and indeed some of the federal funding which is provided in certain ecosystems for playgroups and early intervention for priority populations. So I think there's a bit of a gap sort of analysis that needs to happen, what's existing. I guess what we're very mindful of is not to assume that the current resources across all of those systems are sufficient to provide foundational supports for children. Thank you.
Thank you. So if you look at the state now then, where are foundational supports most required in your view if we had to prioritise a rollout? Where would we be prioritising it and for whom?
So I think in our submission we talk a lot about the very early intervention prevention. And so we know that much of our work starts with early screening and really finding where the families are in the system. And there is really a no wrong door. So families will come in through GPs, they'll come in through health, they'll be in antenatal clinics, they'll be in supported playgroups, and they'll be in neighbourhood centres, and they'll be in a variety of, every door's the right door kind of way. But I think what we see, and our statistics bear out, that we've only got 20 or 30% of children in different jurisdictions across Australia that are actually having their developmental screening milestones. And so we do believe that starting with a cohesive approach to developmental screening and making sure that we have families that fall through the cracks, so the priority populations, culturally and linguistically diverse families especially, and First Nations families. How do we design a system that meets a family where it's at? So if it comes in a health door, we can screen. If it comes in a playgroup door, we can screen. And not just screening the children, but also the health and well-being of that entire family. So parental well-being and mental health and some of the stresses and the socio-economic pressures on families as well. So you're looking at a whole of family, whole of community approach. And so I think if we start there, then we're looking at navigators and integrated models of care so that if a family comes in, whatever door they come in, and they have their developmental screening and psychosocial and other things are, sort of, I guess, identified at that early stage, that navigator can help families navigate this very complex service system through early education, disability, social services and health services. And that should stand for whatever door they come through, yes.
I really like that, the term community based navigator role. I think there's been a similar thing that's come up in other submissions with different sorts of names around it, but it's a similar sort of concept.
Yes.
And when you look at the way that services currently sit in a very, I guess, government gives funding to particular services that then provide their services out, and it's all governed by that sort of funding structure. Whereas in an ideal world, you would design it the other way around. You'd have as you say, you meet the families where they're at.
Yes.
And regardless of where they come in, they're able to access the service, and then the funding kind of follows.
Correct.
I guess, how do we, with this rollout of, or this new focus perhaps on foundational supports, do things in a better way to try and do that sort of more integrated approach?
So it's a great question, and there's been quite a lot of work done. I don't know if you're hearing any evidence from the National Child and Family Hubs network, but I'm also part of that national network, and there's about 476 child and family hubs across Australia that are already established, and there's different streams of those hubs, if you like. There's primary care hubs that are for early parenting and child and family health, but are very GP, medical, hierarchical. Then there's some community hubs that are run by NGOs that in fact, my role in Karitani, working with groups like Playgroups New South Wales and bringing wraparound supports into a hub of existing service providers. So they already bring their funding in. So it's not new funding, if you like, but we do need support to make that collaboration happen in a formalised, structured way. And there's also then school hubs, so you might have navigators in schools, particularly some of the lower priority population schools and school hub navigators. So we capture those first 2,000 days in these child and family hubs, but there's also community hubs for children transitioning to school and then into the early years of school, particularly for new arrivals. And I'm based in Fairfield, so people that easily fall through the cracks through language barriers or socio-economic barriers. So I think there are some really good models of this in existence. We just recently heard, we've had a UK visitor, Mark Smith from the University of Manchester, talk about relational contracting. So how does the government incentivise not just relational care, but also relational contracting? So how do we incentivise organisations to partner quite purposefully, and to build the workforce capacity to think beyond being funded as a singular organisation, but we're being funded for a hub, and some of us may have existing resources, and we may need a bit of a top up to create navigators and backbone supports and data, things and governance models, but you're not really starting from scratch, and you're not just using the state funding, you're using organisations and NGOs and not-for-profits who are partly funded by federal governments already. And so I think when we do that service mapping, if we do that by priority populations or LGAs and have a look at who's funding what in that particular geographical region, we can start to think, okay, well, how much are we using the funding to the best of its ability? Is it well coordinated and being used efficiently? And are we getting impactful outcomes? I think we're all waiting for the ADC data to come out, the 2024 data. Are we using it effectively? But is there a gap, and who could or should or would fund that gap? So if it's capital works funding, if it's backbone or glue funding to run these sorts of hubs, or it's actually a gap in service provision. And we know that there's lots of gaps in allied health everywhere, disability, in healthcare, and we know that in foundational supports there's going to be a great need for allied health services. There's going to be a great need for diagnostic, paediatric, psychiatry, children on the spectrum and, diagnostic pathways. And indeed the child and family health. So, where families are entering the system in healthcare, how do we tap them into this broader ecosystem with these navigators? And indeed, who are these navigators, and what training do they need, and what industrial requirements do we have to build that navigator workforce? You can be a nurse, you can be a social worker, you can be a psychologist, you can be a healthcare, you can be a variety of people, but we've got to really develop a navigator workforce. And if I may say, there's some great models that you may hear from some of our colleagues around the peer workforce. And we're hearing more about peer workers and the influence that peers can have, and how we can utilise peers in a peer workforce model, and also trained volunteers. And so how do we scaffold and create a sort of stepped care workforce from professional, peer and trained volunteers, because we know we've got scarce resources. So there's some very lovely pockets of work out there that we can bring to the committee's attention. Yep.
Thank you, very useful.
Just following on from that, could you actually talk a little bit more about that peer workforce and the role of the volunteers within that as well?
Yeah, sure. So I think in summary on page 4, we've got a little bit about the peer support and peer workforce models, and then in the body of our submission, we do, and in fact some of our organisations that are in CAFSA, that's purely their entire role. So in terms of the peer workforce, and trained volunteers, I can give you an example of Volunteer Family Connect, and that's a program that's run by Karitani, and it's a stepped care to maternal, child and family health nursing. So it's families that might be new arrivals, they don't meet a threshold for professional care, but it might be a parent who's isolated looking after a child or multiple children. They may or may not have a disability or have extra support needs, and so that family needs support in their community, but they may not need a professional nurse home visit or something else. So the trained volunteers actually then wrap around and stay with that family almost like for about 12 months as a key worker, but they've got an escalation pathway. So if things are needing professional support, that volunteer is trained, through an evidence-based training pathway to provide support. Then with peer workers or people with lived experience, so it's making sure that we can bring people with a lived experience through a diagnostic pathway, or parents with managing children with similar developmental concerns, etc., and how we bring them into show how they may have navigated the system or the lessons that they've learned. And so there's often builds a lot of trust. In fact, we've got a young parents program in southwest Sydney, for example, called Village Connect, and there seems to be quite an overrepresentation of young parents with children with some sort of developmental needs and concerns. And we brought in a peer young parent workforce to work alongside them, and they've talked about how they've navigated, and it builds a real trust from the get-go, that reduces the stigma and some of the challenges, I guess, in explaining where they're at. So I think there's really a lot of peer-led programs, but they must be free or low cost. Yes, and off you go, Dina. Yep.
So I was just going to add to that, because it's really important in the representation of called communities, especially for universal access, because this is basically what we're talking about. We're talking universal access to foundational supports. And what Grania was saying about the community hubs and the peer support is critical for those harder to reach communities, the communities that are not accessing and will not access services. So working with newly arrived families, we know they're not even taking their children for your mandatory health checks because, one, they don't have the literacy. So literacy around how you navigate the systems, what systems are actually there And the people that they trust are not necessarily doctors, because in certain communities, it's a very gendered culture. So women will be accompanied by their husbands to a male doctor, and their husband will speak for them. And that won't necessarily mean that the information and advice and support the woman gets, it's actually the one that she needs. So what these women are finding is they go to another woman in their community who has already navigated the system, that has been here longer, and that's their trusted source of truth. So these women are already doing the peer navigation in a very informal and organic way, and already supporting these women with young families whose children may have developmental delay and other issues, to navigate a system that is beyond complex for them and their literacy levels. So I cannot reiterate enough how important it is to have peer support, trusted community leaders helping families with children, and in a space, a co-designed space like these community hubs, where they can go and feel safe, because this is about safety.
Thank you. I might hand over to my colleague, Mrs. Mitchell.
Thank you, Chair. Thank you both for being here and for your submission, and particularly the case studies. It's really good to get an understanding of some of the specifics, so thank you for that. I was also interested in the peer support, but I think you've answered the questions that I have on that. So I wanted to turn to the part of your submission where you speak about early childhood intervention, and obviously I'm acutely aware of how important that is. But I wondered if you could talk a little bit more about, on page 22, where you talk about some of the challenges for both educators in early childhood settings and also in classroom settings where children need to be pulled out. So it's sort of the second dot point on the top of page 22 is what I'm referring to. I guess just in terms of your experiences, what are some of the ways we can help address those challenges, particularly around, I guess, capacity building in early childhood educators, but also what needs to change in schools to allow, I guess, better access for those services for the children who need it? And I'm happy for either, both, whoever wants to answer. So.
Yeah, I'll just talk a little bit about it. From our experience, we have found that often children with disability that have been assessed that go into school that need extra support, there's basically two things that happen. One, often there is a challenge around who pays for the support, because it's what Grania was saying earlier about is it an NDIS Commonwealth issue? If the child is on a NDIS package, does it become a New South Wales Government Department of Education issue? So there's challenges around that to begin with. Then, as you've pointed out, there's challenges around capacity building educators, around having children with additional needs in classes, and then about the timetabling, and if they need a therapist, if they need a speech pathologist, occupational therapist, the timetabling and the scheduling of these services can often be challenging for the regular timetable of the school, which can often be quite rigid, and that definitely poses issues. What we can do around that, I'm happy to take it on notice, or if Grania would like to add, but we see it at a school level all the time, and it definitely is an issue that needs to be addressed, because what happens is it breaks down the seamless educational pathway of the child if they're being taken out constantly out of class, and not only taken out, but if there are challenges as to when they can be taken out, when is the therapist available, when is the teacher available to take it out. So there's all these scheduling challenges on top of everything else.
And I think too, many of us were on a committee that Ms Boyd chaired into looking specifically at support for children with disability in educational settings, and it's a theme that came up there as well. So, yeah. Did you want to add anything, Ms O'Loughlin? You don't have to, but...
no, I don't at this point. Thank you.
Okay. I'll leave it there, Chair, and let someone else have a go. Thank you.
Thank you.
Mr. Deanna?
Hi. I mean, obviously, there's a big bucket of money that's prospectively coming around foundational supports, and I think that obviously gets a lot of people thinking about the opportunities for additional initiatives. But ultimately, even if it's a big bucket, it's still a limited bucket. And I think we had an earlier contribution where I asked about the definitional question of what constitutes a foundational support. And through the proceedings this morning, it's quite clear some people have very broad views, others perhaps a little narrower. And so I wanted to get your view about what should be the core way we define what is a foundational support.
Okay. Look, it's one of those sort of slightly intangible things as we speak about it. And so, we've been looking at the federal definitions and the Productivity Commission report and reform papers into targeted foundational supports definitions. And I suppose that's the ones that we've been working to in CAFSA. But in speaking with our colleagues across the ecosystem, it does feel like everyone has got a different definition and a different threshold. And some people think they're already providing foundational supports in one way or another. And that is probably true, depending on how broad your definition is. And so I guess what we would do is we would actually turn it back to say we need to seek a common definition that everyone is working to, and then work out what's in scope for that. Because I think even in reading some of your submissions, I think it was the Autism Australia said we still don't really know what foundational supports are, and we feel that it's challenging to make some representation on it because it feels sort of rubbery still. So for us, in the health world, it would be children who reach a threshold on a developmental screening tool that means they need more than universal supports, and there's somewhere between universal supports and meeting a threshold for an NDIS plan that is going to create a world of foundational supports. And you're right, this bucket is not going to go across all of those ecosystems, and how do we know, in fact, which part of that ecosystem to put that money in, because these families actually touch multiple points. They don't just sit with one organisation or one part of the system. They touch education, they touch health, they touch disability services. And so, I don't envy the task of working out the funding model for foundational supports. It is complex and challenging. Yeah.
I think there's a sort of assumption around the structure. Obviously, the NDIS has created a structure with an ecosystem of a lot of not-for-profit and non-government providers, and so there's a sort of assumption that the delivery of foundational supports will replicate that sort of ecosystem approach. I think you touched on this idea around long-term funding and relational contracts and a different way of procuring. I want to pose to you sort of an alternative proposition, which is perhaps when we look at the bucket of money and we carve it up, most of it's actually going to be consumed by direct state delivery. And whether that's a better model, or why you might disagree that it's not a better model in terms of just having some high degree of line of sight about what's being delivered and the accountability for that expenditure.
I'm happy to...
Yeah, answer, please.
Look, I do think putting all the responsibility into the state bucket will create a very different way of working for a number of the NGOs who are currently funded. So if we look at, I guess, the funding mix for a number of the organisations that are funding, I would say everybody's got some federal funding, some state funding, some philanthropic funding, and different grant fundings. There's a real hodgepodge of funding mechanisms, and some of them are short-term, one-off grants, etc., etc. So there's a funding sustainability issue for many of the not-for-profits that are funded in short-term grant rounds. And even if we look at, so if I compared the targeted early intervention funding rounds by the state to the DSS Communities for Children programs, for example, and some of them are covering similar geographic footprints, you would hope that that's symbiotic, complementary work and that there's not duplication in that system. But if one or the other of those gets removed, you've got to work out what gap it's leaving, or what gap, say, C4C funding disappeared in a LGA, what would that burden be onto the state? So I think there's a very big funding mix review, I guess, to see what the proportion of not-for-profits are that are funded currently by federal funding for different funding rounds. And we know that there's a big DSS review, obviously, around the communities for children, strong communities. And also, I would say the necessary and rightful funding shift to Aboriginal community-controlled organisations and the transition, and how we workforce capacity build, given the overrepresentation of First Nations children. So I think if there was to be some sort of community funding split between federal and state, it would then beg the question, well, what is the federal government's skin in the game in supporting foundational support? So is it CAPEX, is it glue funding, is it relational contracting for supporting child and family hubs so that the state is the service provider, but if there's CAPEX or this sort of glue funding for child and family hubs or whatever that could look like. So I think everybody's open to different options of what that funding could look like, but I do think that relational contracting opportunity and commissioning, collaborative approaches to service provision is one that's very ripe for exploration. Yeah.
Thank you.
There was a couple of things you raised about, I suppose, a gap analysis. Are you aware if that is being undertaken at the moment? And if not, what's the scope of it? What would you expect?
It's a very good question. It's also evolutionary, because it's always a point in time when a gap analysis is taken and things spring up and disappear quite rapidly in our child and family ecosystem. I would say that there's a fragmented approach to doing a gap analysis. So from time to time, when we're going through, for example, the TEI reforms, there'll be a statewide TEI, sort of what are the NGOs currently providing in TEI. Then I've participated in DSS gap analysis, and I guess it's getting the peak gap analysis people to speak to each other. So I think the work is being done, but it's being done fragmentedly, and it needs to be looked at, brought together holistically. And as soon as you've done a gap analysis, it's like, when are these funding cliffs coming? Like, who's going to lose funding for something on the 30th of June that may or may not be refunded? So how current is it? So who's keeping their finger on the pulse and looking forward to 3 to 5 years of scanning? And that's why I think the recontracting is really important. So it's important in so many levels. One, you build trust in communities that you're providing these services. Two, you've got workforce contracts for people that you spend a lot of energy and effort and money in building the capacity, and then the funding runs out and you lose your staff, and you've got to either start again or lose a service. So there is wastefulness in workforce capacity building if we can't retain staff because we've got these short-term contracts. And I think the potential to create some better centralised workforce capacity building, it happens often at organisational levels. So how do we fund peaks and others to look at workforce capacity building, because many NGOs are trying to get people up to skill, but how do we get more centralised competency standards in or workforces, and how do we run that centrally, as well as the training arm for that. So yeah, I think look, it's big work, but it's quite exciting because it feels like there is an opportunity to really work with the federal government to get this funding sort of sorted. So the gap analysis, I would say, and the AEDC data will give us another snapshot of where we've got our priority populations, starting school with 1, 2 or more developmental vulnerabilities, and I think that would give us a good sense of which communities, at least, we need to focus our attention on in New South Wales.
And I suppose we've got a situation where some organisations have been federally funded. They know that they're no longer funded under that model because of changes. I think obviously there was an expectation that foundational supports and the state Commonwealth agreements would all be settled.
Yes.
So we're now in this sort of limbo land
Yes.
where 30th of June there could be some that will be unfunded, which again creates a bigger gap. Are you aware of where those organisations or areas of concern are now, and what needs to be done to, I suppose, give them a safety net or transition until something is finalised?
If I may speak, one of my other hats that I wear outside of what I'm speaking about is I'm the chair of the Ability Roundtable benchmarking national organisation that looks at benchmarking across the disability sector. And we've been doing white papers to the federal government in the funding gap and, in fact, the at-risk disability providers and the cost to provide allied health interventions in disability and the large private sector of allied health in the sector. So I think there are definitely organisations going into administration or close to who can't break even, and we've looked at probably about 30 to 40% that are not breaking even. So I think there is, a very big risk of some of these not-for-profits not being able to deliver and disinvesting because they're making such a heavy loss. And I think that burden of those services then not being provided in the system, ultimately it's the families, these families that we say are at the heart and the centre of what we do. But it's if they have to disinvest, these families are actually left sitting in this transitional, limbo land. So I'm not clear what the transition plan is. I don't know if anybody is clear what the transition plan is.
Is there a plan?
I'm not aware of a plan.
Okay. So these families, will it become a cost shift straight to the state, or is it that they will fall through cracks?
Probably a bit of both, I would think. So if there are NGOs going out of business and not-for-profit, I would think that ethically and morally they will do some sort of transition plan with families that are in their, care and look for alternate support pathways. But the reality is they'll be passing it to somebody who won't have enough supports to pick it up.
Be already at capacity.
Yep.
And if I can add, because we work with a lot of small community-based monocultural providers, they are part of that group that Granier was talking about, where they live off funding, which is obviously quite small, and they live from year to year, not knowing whether in the following year they will be funded, and they work with families within their communities as well that are obviously quite vulnerable. And so everybody is looking at what's happening with foundational supports, because it'll be such a large shift in terms of funding and all the challenges that will come with that. Where do these families go? A lot of the very small grassroots community organisations are already partnering with larger organisations to try and mitigate the challenges and the gaps facing the families if they get defunded, and try and transition the families across. Whether these families will continue, because with community organisations, they've had relationships with these families for years. So it's not just the parents, the siblings, the smaller children that are born to the families, like they've had generational sometimes relationships with families. So even if you try and transition them to another organisation, doesn't necessarily mean that those families will continue going to that new organisation for support. But yeah, the smaller community-based organisations at the moment are really vulnerable.
Mm-hmm. Just another question, just around the, and you touched on literacy, and I wanted to focus a little bit more around health literacy in particular. And what are the particular needs of vulnerable communities, Aboriginal communities, coal communities, to increase awareness, and what are the strategies to reach out?
Okay, I'll start.
You can start.
Oh, gosh, where do I start? So literacy obviously is not about language, and one of the things we find is that sometimes, because it's expedient, the easy way out is to translate something into the language of the community that you want to target. But translations and language is not literacy. Literacy is about knowing the system, knowing the culture of the system, knowing how to navigate that system. That's literacy. Language is just a small part of that. And so what we're finding is people are being given brochures in that language. They may not even be able to read their own language because their own literacy levels may be quite low. But also they can read the language, but it may not make sense to them because they may not know what it's even about. Places where we are receiving newly arrived migrants don't have the systems that we have for supporting education, disability, or health checks for early years, any of those systems. It's very new to them. They've never heard of these systems or accessed them. They don't even know what they don't know. So what we find is, as I've said before and what Grania has said, is peer navigators are the answer to that literacy because they are able to help families navigate really complex system in a very simple way. And they are able to take them along on the journey. So it's not about handing out a flyer. It's about getting the family by the hand and walking with them through all the challenges and all the sector. For example, in our play groups, one of our deliverables is that we need to show how many children from play groups access preschool. And we knew for some newly arrived communities they weren't accessing it. And when we examined why, it's because we gave them that information beautifully designed on pamphlets in their language, and it stayed in the mother's bag. And when our bicultural worker took the mum with the child by the hand to the preschool, introduced them to the preschool, showed them around the preschool, explained what the preschool did, make them feel comfortable, that mum went back to that school because they also found out like the way to get there. Sometimes they don't even know how to get there. They don't know how to use GPS. They don't have cars. So that was the difference, that having somebody navigate them through the system, introduce them, make them feel comfortable and safe is what got them to where they were. That's literacy.
Yeah.
Thank you. And I might add to that. Thanks, Dina. That's great. So we've been looking at navigator pathways in the disability sector, but also in the child and family sector. And we've been looking at digital literacy. There's a lot of information that's put on websites and other, central places. We've also been looking at the kind of ways the younger generations, I guess, are accessing, and through TikTok and Facebook and 30 Minutes and peer things. So there is a real shift actually in how the younger parents and families want to access their information. So, and we've got the AI, elements coming along. So I think there's a real opportunity here to look at digital literacy, e-navigation pathways. There's lots of apps and things that are out and available. There's an e-navigation system called Barb by Kindship that has a fantastic pathway for families to navigate to the best point of care in disability. And so I think when we're looking at our gap analysis, and we're certainly very focused on place-based initiatives and pathways, but there is also e-navigation and e-pathways and e-resources and online and self-help and peer online and other really untapped and I guess evolving ways to access supports other than in-person place-based supports.
Thank you very much. I'm mindful that our time has expired already. Is there anything else that you'd like to put on the record or recommend that you haven't covered?
I'm just going to check that because obviously we're representing another group, and I just want to make sure that we have really addressed the things that we came to talk about, and I believe that I think we have addressed the recommendations. Thank you very much.
Thank you. Yes. And also, on behalf of the committee, I just want to also extend our appreciation and thanks that all that you do for families and young people across New South Wales, but also Australia, as you are a bit broader. So thank you very much.
Thank you.
Thank you very much.
We look forward to hearing the findings. Thank you.
Thank you.
Good afternoon. Thank you for coming today. Before we commence, I will need to ask that you state your name, your organisation position, and also either swear an oath or take the affirmation, the words of which I understand are in front of you.
Okay. My name is Nicholas John May Blaxall. I'm a NDIS appeals advocate working for the Multicultural Disability Advocacy Association. I solemnly, sincerely and truly declare and affirm that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth.
Thank you very much. Before we commence, is there an opening statement that you'd like to make?
Yes, I've got a statement here I'd like to open with, if that's okay.
That's fine, thank you.
The Multicultural Disability Advocacy Association of New South Wales is the peak body in New South Wales for people with disability and their families and carers, with a particular focus on those from a culturally and linguistically diverse and non-English speaking background with disability. Our vision is a society where everyone, regardless of background or disability, feels welcomed, included and supported. The NDIS review recommended increased funding of foundational supports and highlighted the impact and necessity for families and young people with disabilities. Through investing in foundational supports, strain on the NDIS itself can be minimised. Foundational supports are especially needed within cold communities that have their own barriers. People with disability and their families and carers need to have more options when it comes to services and supports. And early intervention support should be of importance. Investment in foundational supports could mean that people with disabilities have better overall quality of life. Children and young people will be better able to participate fully in their community, school, and see increased social development. Funding foundational supports in an educational setting such as schools is in line with the New South Wales Government's recent performance and wellbeing framework. Foundational supports not only have a significant positive impact on the health and wellbeing of children with disability, but also help families and carers feel more supported, equipped, and resilient in their caregiving roles, supporting the entire disability community to be more independent. Foundational supports are an essential safety net for the many individuals who fall outside the NDIS framework, while also enhancing outcomes for those within it. With proper investment, these supports can promote inclusion, build capacity, and ease the long-term strain on government systems. Schools, families, and communities must be equipped with the right tools, training, and resources to ensure that all children, regardless of background or ability, are given the opportunity to thrive. The Multicultural Disability Advocacy Association appreciates the opportunity to contribute today and urges the committee to consider the perspective and lived experiences of CALD communities living with disabilities.
Thank you very much. Just to give you a bit of an overview, we're going to have free-flowing questions rather than allocated times. And we do have a number of members who are also online as well. I might start with just a couple of questions. Could you give a bit of an overview of some of the advocacy work that you've been doing, particularly since the changes that have been announced around the NDIS?
Okay. I guess the advocacy work in a whole that I do since the changes for the NDIS happened hasn't changed. It's more the outcomes that have changed, and to some degree the difficulty in obtaining those outcomes. It has become a lot more difficult in actually obtaining the outcomes that people are requesting, and we are getting a much higher degree of people applying to our organisation for advocacy work simply because they're unhappy with the original plan they're getting, and then realistically, when they go through the tribunal process, they're not able to get the outcome they want because the legislation is no longer allowing them to get the outcome that they've had previously in the past, which is leaving them in a position where they feel like, particularly for young children or those that are going through a significant life change, like leaving school and moving on to the next stage of their life, that the supports they want just don't exist either within the NDIS or within the systems outside of the NDIS, leaving them in a position where they're not being supported.
And what is the pathway for an individual or for a family once they're told that their appeal has been unsuccessful? What options are available at the moment?
Realistically, they can put through another request to appeal the decision if they wish at the tribunal. Very few choose to do that because by that stage most of them have been at the tribunal for close to 12 months, and they need a significant reason to appeal the tribunal decision to justify that the decision was incorrect. They need to actually be able to prove that the decision that was made was against the law. So very few actually try and follow that path. Most of them turn around and say, I'm upset with the decision that was made, but I can't do anything about it. They will try and work with the plan that they currently have if they are on the NDIS, or they will try and find some other form of support, and we hear back from them in 3 to 6 months' time with further evidence claiming that the current situation is not working for them and they do need to try again to go to the tribunal to get further funding, because they now have further evidence and believe that they can challenge the previous decision.
Do you do any work in referring them on to other services, support services?
As I said, it depends very much on the age. A lot of the decisions that I've worked with have been for young children.
Yep.
And a lot of those are requesting funding for accessing special schools, or funding supports to help them build their capacity outside of school services. Obviously, the NDIS's decision is that the NDIS is not responsible for any funding within an educational environment, because the legislation states that the NDIS is only responsible for funding within the NDIS funding, whereas funding that should be the responsibility of another government department or service should be the responsibility of that department or service. Therefore, funding within the educational system should be the funding of the educational system. And that unfortunately leaves a lot of people only getting supports like occupational therapy or speech therapy instead of funding for support for special schools, etc., that they're asking for, which is, they then turn around and argue that's insufficient. They will then send their child off to a regular preschool for 6 months because they can't find a spot in a special needs preschool. And we get reports given to us 6 months later that they are attending the regular preschool for an hour or half an hour a day, and due to aggressive behaviour or being unable to communicate due to being non-verbal or similar difficulties, the mainstream preschool is unable to look after them, and after half an hour to an hour each day at the preschool, their parents are being called to take them home because the preschool just doesn't have the resources, the staff don't have the training to look after them, and the provision of occupational therapy and speech therapy is insufficient to develop the skills that they need.
And one other question before I hand over to my colleagues, just around access to, and it's been raised earlier today, and some people have called it postcode lotteries or location lotteries, that there's an even allocation of being able to access services. And I'm interested to know about some of the particular challenges that may have been raised with your association that are affecting multicultural communities.
That is something that is of importance to us, is the difficulties of getting into the multicultural communities, because it is obviously our area of specialty, and it is something that we do have experience with, and we do realise that is an area of difficulty. It is something that, if you read our submission, it talks about the fact that there needs to be people employed within those communities that actually know the community, that actually know how to communicate within the community, speak the languages within that community. There needs to be interpreters employed within that can speak the languages within the community. But yes, it is certainly an area of concern to us that there is shortage of places within COLD communities. There's difficulties trying to get the COLD communities to access certain services. That's a major barrier that we're well aware of, and it's one that we are working on. As for a short-term answer to that one, I don't believe a short-term answer that we can come up with in the next 6 months exists. That's going to be a long-term issue.
I might hand over to the Deputy Chair, Ms Boyd.
Thank you very much, Chair, and good afternoon to you. Just on, I guess, in your submission you talk about the importance of disability advocacy organisations. Can you explain to the committee, I guess, why disability advocacy is so important, and how that interacts with a true co-designed process, and what we should be looking for here?
That's a very good question.
It's a very big question, sorry.
I think that's one that I could very well take some time to expand on, if you give me the opportunity to expand on that. I would like to take that on notice to expand on that one.
Okay.
I could give you a short answer now, but I think that's one that, to do justice to, I would like to take on notice, because it probably deserves more consideration than I can give it in the next couple seconds.
Understand. I guess then, I mean, how important do you think it is for, given the gaps that already exist and the problems that we already have in the services that are available, how important do you think a co-designed process for rolling out foundational supports is, to make sure that we don't, I guess, repeat mistakes? My questions are not very clear, so if you want to take that one on notice as well, that is fine.
It would be very easy to make mistakes, particularly within the COG communities. You would need to interact with the COG communities. You would need to have people from the COG communities who know that community. You wouldn't want somebody who presumes that they know the community to be making decisions on their behalf. You would want the COG community themselves to be involved in the process of developing the foundational supports. That's something that we have learnt in the past from prior experience. And I'll be honest, it's something I've learned from my own personal experience, that you do need to to actually get the community involved, not presume that you know what the community wants. So that is a key to that question. It would be a very difficult one when you're talking about a multicultural society like Australia, because obviously you don't have set sections of different communities living in certain areas. You do have certain suburbs or certain areas that have a higher density of certain communities or certain languages being spoken. And obviously there's a need for services using that community, that language, that nationality in that area. But it's not going to, as I said, it's not going to be a 6-month fix. It's going to be a long-term fix. And it does come back, I guess, to your original question that when you don't have a simple solution to something, you do need the advocacy as a backup. Because when you don't get the answer right the first time, you do need the advocacy as a solution to try to figure out what the problem is, to try to go and solve the solution, go to the services, go to the organisations and try and figure out, where we failed to get it right the first time, see what changes need to be made, and have the organisation to help support the individual, support the community, and figure out, what needs to be done, whether it needs to be done for an individual or whether it needs to be done on a grand scale to change the entire setup, the entire community, change the government's processes or the organisation's processes rather than, just trying to help this one individual.
Thank you.
Mr. Gavin?
So we've heard evidence earlier today about the issue of stigma associated with disability in some core communities. I wonder whether you have any thoughts on what can be done to try and address that barrier to some parts of the community accessing services.
I'm sorry, I didn't quite catch that question.
So it's been suggested that in some called communities, there's a stigma associated with, I suppose, identifying that your child may have a disability, and that this then presents a barrier to them accessing services. And I wonder whether your organisation has a view about what needs to be done to try and address those questions around how we overcome that, I suppose, that hesitancy that might be there in some called communities.
I will agree with you that personally, from what I have come across, there are different communities where that stigma does exist. As to a solution to that, I might need to take that question on notice. Sure. Because I don't think I have an answer to that one myself. My organisation might, but I don't have an answer to that one myself off the top of my head at the moment.
Okay, thanks. That's all.
I just have one question, or a couple of questions. One is, one of the recommendations in your submission is about further investment in culturally appropriate services and supports. Could you give an example of the types of supports that are needed to improve, I suppose, engagement with Cole community?
It would depend very much on the communities. It does depend very much on the culture, so it's not a one-size-fits-all approach. I think we might need to take that question on notice too, because I can't do that question justice in the time we've got available.
That's fine. The other one was it was raised this morning about, or earlier about, I think it was around 20 or 30% of children are having health screening and early development checks. Do you have any suggestions on how better to engage the whole community to increase the number of families and children that are having checks?
That's actually outside of my knowledge, so I might need to take that one on notice too. Sorry.
No, that's fine. Well, that concludes, I think, my questions as well for today. But on behalf of the committee, I'd like to thank you very much for all that you do, particularly as an advocate for families and young people with disabilities. So thank you very much for coming today.
Okay. Well, thank you.
Thank you.
Thank you.
Everyone's ready?
Yes.
Thank you very much for coming in this afternoon. Before we commence, I'll need you to state your name, your title, and also either swear the oath or take the affirmation, the words of which I understand are in front of you. And we'll start with Ms. Campbell.
Thank you. Anne Campbell, Deputy Secretary, Strategy, Policy and Commissioning, the Department of Communities and Justice. I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth. So help me God.
Hello everyone, my name is Gillian White. I'm the Deputy Secretary of Social Policy and Intergovernmental Relations at the Cabinet Office. And I swear that the evidence now about to be given by me shall be the truth, the whole truth, and nothing but the truth, so help me God.
Thank you very much. Would either of you like to make an opening statement?
No, we're happy just to take questions.
Perfect. Well, I think I'll start. I think when we began, we expected we might be a little bit more advanced on what foundational supports is and where the state and Commonwealth are up to. But I think particularly in light of recent comments by Minister Butler that indicated there may not be a clear understanding towards the end of the year. Could you just give an overview as to where things are up to around the state and Commonwealth plans, particularly in light of expectations of things coming to fruition by 1 July this year?
Absolutely. I can start, and we're a bit of a double act,
Yes.
so we'll just have that as quite conversational if that works for the
That's
committee.
perfect.
So you say yes, so quite helpful timing for you all to have heard Minister Butler's comments. But yes, it is fair to say that the states and territories are continuing to negotiate with the Commonwealth. You'd be aware that in December 2023, there was a national cabinet decision, and that decision was about progressing both national health reform negotiations as well as disability reforms. And so those two negotiations in effect became quite tied together. So over the course of over a year, there's been some progress and some toing and froing on the nature of those negotiations, which culminated most recently in a 1-year agreement that was reached not too long before the federal election. And in that 1-year agreement, there was certain decisions made about some additional health funding for a 1-year health addendum, and then commitments that were made about continuing to progress the work on disability reform. And the nature of those commitments were about continuing the process on NDIS reform as co-governors of the system, and also as articulated in some of the changes to the NDIS arrangements that had passed through the Commonwealth Parliament. But in addition to that, there was a commitment made for the states and territories to continue to collaborate with the Commonwealth on the design of foundational supports associated with the 0 to 9 age cohort, and in addition to that, to continue progress on general foundational supports. So it is one of the cohorts that was articulated in the NDIS review. So on the back of that commitment, we obviously communicated that widely within New South Wales government circles and have begun to reach out to relevant stakeholders. So before then, there was a little bit of uncertainty about timing and next steps, but we're now beginning the more detailed process of informing stakeholders that at this stage, there's an agreement about progressing the design on 0 to 9 foundational supports. We're working in good faith and in detail with Commonwealth officials and at a political level as well. And that's what we'll begin more consultation on, and Ms Campbell can go to that detail in the course of our discussions today.
Mm-hmm.
I can touch on
Yeah,
that now if you like.
yeah.
So we've developed a communications and engagement strategy approach to really inform the design of foundational supports for New South Wales. We're establishing a foundational supports group, it's called a Children's Advisory Group for Foundational Supports, and we're hoping that will commence in June this year. And I can't go into the details of the makeup. We're still working through some of those issues because we've also got to be cognizant of, if we do go out and commission services in the future, that we abide by procurement guidelines, those sorts of things. But it will include membership, will include experts in the field of disability, early intervention, early childhood peaks, advocacy, Aboriginal and multicultural, health, parent reps, health, TCO, education, and I think I've said health already. And we're also looking at how we engage with people with a lived experience of disability. So we'll be doing about 30 consultations in face-to-face across New South Wales and 6 webinars in the second half of 2025. For families, carers, the sector and people with disability will be engaged in those processes. And we'll also, I think about a third of the sessions will be led by an Aboriginal-led consultant to make sure that whatever's developed is culturally appropriate, because what we know is it's going to work differently, foundational supports for different communities. And then we're looking at some half-day forums really focusing on autism and disability inclusion as well. So that's just the beginning of it. We're hoping to have a website up running so everyone in the community can actually see the consultation schedules and what's occurring. So that's just a quick summary.
And what's the time frame? So for, I suppose, when a final decision will be made between the states and the Commonwealths, has that been landed?
No, that hasn't been landed. Certainly, conversations will now ramp back up again following the outcomes of the federal election. And certainly we all noted with interest the connection in Minister Butler's portfolio with those two areas. We know that the Commonwealth has a great deal of interest in relatively speedy progress on foundational supports. And I think state officials share the view that there's a real balance to achieve here at both maintaining good progress and giving confidence to the public. But in addition to that, really, we are talking about growing and enhancing and potentially building new aspects of a service system. So we are conscious of how much work it took to establish the NDIS in the first place, and with changes to the NDIS, we need to have genuine time to collaborate, design, procure effectively through that process.
And I can add to that too, there has been consultation that the Commonwealth has led during the latter part of last year, and states and territories attended a lot of those sessions and webinars. We also ran a couple of sessions, and I should say in November 2024, DSS, so the Department of Social Services, and I think it was called the Social Deck, actually did a feedback on what they'd heard through those consultations. So there were 3 key areas that they identified. Governance and quality are inconsistent across different levels of government. That people with disabilities and their families, carers and communities must be included in all stages of support design. Supports need to be person-centred, holistic, flexible to meet the needs of people with disabilities and integrated into the existing service system. So what we're obviously wanting to design isn't something that's siloed, but something that actually is an ecosystem of disability supports for children and families. And then the third area was the introduction of a new support system is likely to exacerbate workforce shortages. So there's a really big piece there in terms of workforce capacity that we will need to be focusing on. And we also ran a couple of sessions ourselves at the end of last year with the NDS and CAFSFA, which has been really useful in terms of understanding what's happening on the ground now. Where are there fragmentation in services? So there's quite a lot of work to do in a relatively, time frame unknown at this point.
And I suppose that brings me to the next question about those gaps in services, and probably more so. One is, is there a review, and it sort of came out today in a discussion, a bit of an audit of what services are currently available and whether or not that's occurring at a state level at this stage?
At this stage, we've done some really basic sort of work, but obviously we're going to have to progress that pretty quickly now that we can actually go out and consult with people and actually find out what's happening in various local communities. What works in regional and regional or remote communities won't necessarily work in metropolitan and vice versa. We know there are very thin markets, particularly in regional and remote areas. I think the NDIS review identified that. And I think the Disability Royal Commission also identified the sort of lack of services available for people with disability in some of those locations. So there's quite a bit of work to do.
And before I hand over to Deputy Chair, just one other question around with some of those gaps was raised today, and we're aware of some organisations that received federal funding that no longer can access those grants. And there's some of them, I understand their funding will run out 30th of June this year. What work is being done around identifying those service providers at the moment that will not be able to continue to provide a service and to make sure people don't fall through the cracks?
I can probably take that on notice. Yep. We can talk with the Commonwealth who fund those programs. And obviously we've now got a new government that's come in federally and changes occurring between what was DSS and now the new movement to the health and disability area. So we'll do our best to follow up and take that on notice.
Right, thank you.
Thank you. If I could just, and apologies if you've sort of touched on this a little bit already, but just we've heard from a lot of organisations and had discussions today with witnesses around people who have had NDIS supports or funding cut off or anticipating that they're going to have their funding cut off and being in the dark about foundational supports. What kind of conversations are states like New South Wales having with the Commonwealth about this?
We have regular conversations, in particular because we do hear those same concerns being raised. As part of the work that we did, and Gil can talk to, Ms White can talk to this after I finish, but as part of the changes to the NDIS rules that were consulted on towards the end of last year, there were concerns from states and territories that the changes in those rules might impact on access and eligibility. We made sure that didn't happen in the negotiation. What we do know is that the Commonwealth, NDIA, towards the end of last year, got additional resources through the budget process and put on a whole lot more people to actually clean up the backlog of reassessments that hadn't been done for a number of years. And I understand that quite a lot of those were children with disabilities. But we're asking lots of questions. We haven't had a recent meeting. We've got one, I think, coming up next week. I sit on what's called the Deputy Heads, which is states and territories with, at the moment, DSS. So hopefully we'll be getting a better update on where those things are at.
Okay. What is happening, I guess, on the ground then when you get people coming to you saying that they're not able to get the services funded that they had previously? Are you seeing that, and sort of what have you done to sort of proactively capture those people and help them?
Yeah, we have a good relationship with the state manager of the NDIA, so we would obviously, not me personally, I haven't recently personally got on the phone about an individual matter, but staff within my area spend quite a bit of time trying to make sure people are linked into the right services and also referring back to the NDIA to find out why a particular person has been excluded and on what basis. So we do a lot of that. We've been doing that not just recently, but I think since the NDIA was established. NDIS, sorry.
What sort of, I guess, modelling has been done to determine how many people in total are going to require foundational supports in New South Wales? Has that sort of work been done?
It's being done at the moment, but I can't say anything further. We don't have anything definite yet from DSS and the NDIA.
Okay.
And I'd just add to that, Ms Boyd, that one of the issues that is being worked through are some of more of the specifics of the developmental delay and autism that would be considered more in the category of foundational supports compared with being part of the NDIS's existing early childhood pathway. And so that can have quite a considerable implication for how many young people that could involve is that more detailed analysis.
Okay. When Minister Washington was last in estimates, we asked some supplementary questions around sort of what the roles and responsibilities are of this DRC task force, and I don't know how that interacts with I think you called it the Children Advocacy Group for Foundational Support. I'm not sure, but how it interacts. But we were told in answers that the responsibilities of the DRC task force were working on significant disability reforms, including the design of foundational supports. What has that group been doing, and how will its work kind of continue on in this space?
Okay, so the Disability Task Force is comprised of about 19 staff, 10 in TCO, around 10 in TCO and 9 in DCJ. For DCJ, it doesn't just include foundational supports, it also includes the Disability Royal Commission recommendations and doing work in areas like restrictive practices, guardianship. It also includes the NDIS review and the response to the review, but equally looking at how all those pieces of reform come together, because some of them, as you know, overlap quite somewhat. So a lot of the work has been done towards the end of last year on the NDIS rules, and and we've actually set up a consultation group now to look at the rest of the rules that are going to be consulted on shortly, and we've got quite a significant group of players on that. The group I talked about is one that's yet to be established. The staff in TCO and DCJ will obviously contribute to managing that particular advisory group. I'll be chairing it, and it'll have reps from the relevant government agencies as well as from the key groups I talked about earlier. So that will inform the work of the task force, and so it's a governance mechanism for the task force.
Okay. And has that task force done any work already around foundational supports or not really?
Yes,
it has.
So it's basically, Ms. Boyd, it's basically some of my staff and Anne's staff. We've been able to build up a little bit more of a team to do because we identified that this was a really significant area of reform, so we needed to have some additional resourcing to do the design work within New South Wales, as well as all the intergovernmental negotiations and all of the pieces that Ms Campbell spoke to. So that's the reason we established it as a task force is we wanted the model of having the central agency and the key line agency working in close collaboration, because we knew this was a whole of government piece of work. So we have strong relationships with our health colleagues, our Department of Education colleagues in both early childhood and schools, the trustee and guardian. So we're trying to integrate it, because as much as this is a really complex area of work, we're actually really excited, because it is not that often that you get an opportunity to look at one of the areas where we know we all have gaps across the country, including in New South Wales, to improve child development outcomes. So we're thinking about how do we integrate our thinking across our big health and education departments, as well as the engine room of DCJ.
And that then also links into what we call the Disability Board that you may have heard about previously, which is co-chaired by myself and Gil from TCO, and has all the relevant government agencies on that. And so the work that we're doing between DCJ and TCO feeds into that board for decision making, and obviously that then goes through the Minister and then to Cabinet where appropriate.
Okay. But none of that work so far has involved consultation with the community. That's in this next stage that's being planned through the advisory group.
We've had some sessions that we've run, because we obviously meet with disability peaks and providers. So I mentioned earlier we've met with We've had a session we co-convened with the NDIS towards the end of last year, and one with CAFSA to sort of get input from members about what do they think are the key ingredients of foundational supports, because obviously foundational supports mean something very different to different people, and I think that's going to be part of our challenge to both understand, I guess, what the funding envelope's going to be, and how we can actually design a system that actually improves outcomes for children with disabilities and their families. So I think one of the key feedbacks from the NDIS review in particular was how transactional it can be. The NDIS, where you're just looking at a plan and a child, this is actually about how do we rebuild some of those supports for families to be able to support children with disabilities and get access to the right support at the right time. And as I said earlier, it's likely to be very different in different communities depending on the makeup of the services. We currently, for example, have a number of programs, the Targeted Early Intervention program, where in a number of those services actually provide supported playgroups. They bring in allied health staff to work with children and people with and parents. So I think there's a lot to sort of tease through, and we're going to have to be really mindful of how it's then implemented once we've reached agreement on foundational supports, and be cognisant of what ecosystem is around in different local communities, what funding's there. So that's going to be, I think, a very tricky piece of work, and it may need to be very phased so that we get it right, but there's been no decisions made because we don't actually have the foundational model for New South Wales.
Yeah. It's really interesting. I'll just ask one more question and pass back for a bit. But I think this, as you say, the notion of foundational supports is different to different people, but also what it looks like, or what that gap between existing services looks like, will be different depending on where the particular community is at in terms of its other services and a whole bunch of other things.
Absolutely.
That makes it sound like a very difficult process when you then have to also worry about funding.
Yes.
So I guess to what extent is funding, or the potential funding envelope, because I guess you're not quite sure what that will be yet, is going to govern the design of this, and how much is an assessment of, a gap analysis and an assessment of what's happening on the ground going to influence back up into funding.
Yeah, and I think just listening at a couple of the consultations last year, there is foundational supports notionally that are already being delivered, but sometimes they're not connected up, and for a parent with a child with a disability, it's very hard to navigate where those services are. So we're going to need to look at both the general supports, which is more the information referral points, and look at how we design it. I think you're absolutely right. It is going to be very different in different communities. I mentioned earlier in regional and remote. I think there is a paucity of services out there that we're going to really need to look at. How do we build the capacity, and particularly in, for example, Western New South Wales, particularly Aboriginal services. So how do we work with Aboriginal communities to design the right kind of response in those locations? So it is complex. I absolutely agree, Ms. Boyd.
Come back to me.
Before I hand over to Mrs. Mitchell, just following on from that in relation to funding, because you mentioned TEI, which is going through sort of recommissioning at the moment. How is that working alongside some of the discussions around foundational supports? Is it envisaged that TEI will remain separate, or will it be integrated in some way with foundational support?
I think that's what we're working through at the moment, so I probably can't say too much other than we are recommissioning from 1 January next year for 5.5-year contracts, and we're obviously cognisant of the fact that the foundational supports hasn't yet been landed. So we're just going to have to manage that dance for a little bit till we're clear about what's the best approach going forward. Noting that we've got an early intervention council, which you'd be aware of, in DCJ, that governs that, which has LCSA, has all the key peak bodies on it. and they're certainly fed in their preliminary views of what should be considered. Neighbourhood centres as places are obviously already delivering a range of services for children with disability supported playgroups, so there's an opportunity to look at how we can leverage the TEI program, as well as, you know, other in education, some of the early childhood services, allied health services, and in some locations, I can't remember the organisation, might have been up in the Hunter, where they've already got a bit of an ecosystem in that location around early diagnosis, even though this foundational supports is about, it's not about diagnosis, it's actually about the supports that children and families need.
Thank you. I'll hand over to Mrs Mitchell.
Thank you, Chair. Thank you both, Ms White and Ms Campbell, for being here. You've actually answered quite a few of my questions, but I have a few and then I might hand back to my colleagues and I could potentially have some more. I wanted to start with I guess just in terms of that sort of cross-agency collaboration, and I know you've touched on that just in relation to that task force that the both of you are leading, but it's come up from some witnesses in terms of making sure you try to, as best as possible, break down some of that siloing in terms of this work. And Gil, I'm sorry, Ms White, you'll understand my interest in this. But is there anything sort of, you know, in a similar way to, I guess, Brighter Beginnings working across agencies, are there other things in this foundational support space where you think that there's opportunity for better agency collaboration? Is that kind of what your task force is trying to look at as well?
Absolutely. In fact, I think Brighter Beginnings is the very same notion, really, and it's actually, you know, so for those who are a bit less familiar, that was a grouping of us which continues to this day in about focusing on child development and how can we sort of break down the silos between agencies and ensure that we can go actually into budget processes with shared positions on where the evidence-based programs really are and how we can expand them. So we, you know, even things like health and development checks in preschools and early learning, Miss Mitchell, is the kind of thing that could be part of the ecosystem. And as we expand sustaining New South Wales families, so specifically like Brighter Beginnings, I think foundational supports will be looking at those existing evidence-based programs and saying, to what extent can we utilise and grow those? But also, as you say, the way of working. So we are very aware that great public servants and great practitioners have a tendency to speak in their own languages, whether it's the Department of Education, Health, DCJ, and so we have some minds coming together to say sometimes we are using different language but we mean the same things. So how could we be less focused on our own neck of the woods but instead put the child and the family at the centre? So that's why we're really excited actually, because this is the new frontier. We've just got the complexity to deal with, which is of course always money, workforce, and obviously managing a large state with various needs. But the kernels of cross-agency efforts like Brighter Beginnings are the sort of models that we're trying to use to say, well, how would we do this at a service level and how would we face that over time?
And then in terms, and I guess, you know, not surprisingly, I'm particularly interested in the early childhood space, but is there, on that task force, and I think, Ms Campbell, you said obviously having stakeholders, but, and you may have said it and I missed it, but in terms, I guess, of that parent and family voice throughout that process and the voice of young people, lived experience, even not just for young people, but what will that look like?
That's what we're having the first group meeting, I think, of the advisory committee later in June. So I think that group will look at the current engagement and consultation strategy that we've got in place and then look at the best way to engage with children with a disability, look at people with lived experience. The early childhood will be on there, and there'll be representatives from parents as well and carer groups. So they're all key stakeholders that we need to engage with, and they'll be part of that particular group.
And we heard evidence earlier today from one of the groups. I'm just going to, the local Community Services Association it was. In their submission, they talked a fair bit about the data collection and sharing. I'm not sure if you had a chance to see it, but they were talking about recommending sort of a harmonisation of data for children with disability and additional needs across all of the social services. They talked about DEX, which I think is the sort of platform that they use. Is there any comment you could make in relation to how that data collection is working at the moment, and if there's any view to harmonise that a bit more across agencies, if that's possible?
I think that's an area that we are looking at. In terms of DEX, which is it's a DSS platform, we know from that data that they do actually collect. They have a yes/no field for disability for children and adults with disability, and they do capture that. And then there's a field that drops down with the disability type. I'm not sure how well that's being used, but we do know in 23-24 there were 16,805 adults and children with disability in the TEI program, which is about 9.5% of that particular program. But equally, we're also looking at the data that's held in Child Story for children with disability and out-of-home care, but equally looking at who's on an NDIS plan to do some correlation. At the moment, there's about 19% of children with a disability in out-of-home care, but I suspect it's going to be much higher when you compare the NDIS plan. So if a child with a disability has an NDIS plan, well, they've clearly got a disability. So we're just working through that process at the moment. So we'll get a better sense of the data. We're also working with education and health, and we'll be looking at similar things in terms of the data. We're also working with the NDIS in terms of trying to understand how many children are likely to be classified as in foundational supports given some of those changes. So I think all that needs to come together to understand, how many children are we actually talking about in New South Wales who are going to require general foundational supports, what percentage will require whatever we agree on is targeted supports. So I think there's quite a bit of work to be done.
Generally speaking, I mean, I'm not as familiar with, say, the NDIS, but do you, what's the data sharing arrangements like between state and Commonwealth? Is that an area for improvement? I mean, it's probably a loaded question, but, does that work well, or does that need to potentially be looked at in your opinion?
Yeah, there was quite a bit of work done last year on the National Disability Data Collection. So education, early childhood, I think it was one example. And we also did one in the justice system as well. So the Commonwealth continues to fund that. So I think we're going to have better data sources going forward around what happens across agencies. In New South Wales, we also have the Human Services data set, which captures data from education, health, police, youth justice, housing. It also captures Commonwealth data, so things around Centrelink payments, around I think PBS and a whole range of things. So we do have a rich source of data. That's obviously de-identified data within the Human Services data set, but all those data sets will come together to give us a good picture. What we're missing at the moment is the data about what the NDIS data is telling us about the likely number of children needing foundational supports in New South Wales.
And just to add to that, Ms Mitchell, I think the NDIA and the NDIS review have been clear that there have actually been some data limitations in terms of what they've collected. So some of our questions, can't all necessarily be answered in terms of what forms of support particular children have been on. And so we're really conscious that as we build the community conversation, it may be that there are families who we will support in the future where we won't necessarily have the specificity of information about what forms of support they've had in the past, because that wasn't necessarily all recorded through their NDIS package. So that will be part of having the workforce well trained to be having those conversations with families about saying we're going to have to do this differently. We're going to have to focus on what you need now and how we can best support you without it being a sort of frustrating exercise of going back and figuring out what boxes they ticked at a different point in time. So yeah, there's a fair bit.
And we also need to understand a little bit more about children maybe not getting services who aren't in the NDIS and shouldn't be, and those that perhaps aren't getting service through mainstream services. So there's quite a bit to tease through in terms of truly understanding the level of unmet demand.
Can I ask one more question, Chair, and then I'm going to hand back over? Probably, I guess, Ms. White, has there been any sort of economic modelling done either by Cabinet Office or Treasury, I guess, in terms of sort of long-term social and economic impacts if these sort of investments aren't made? And also, I guess, on the other side, the importance of making these sort of investments in terms of the long-term positive impacts you can have with the right foundational supports?
I think as we work through with the government, the business cases that we'll obviously have to finalise to underpin government consideration of the funding flow, Ms Mitchell, that's obviously will be a key component of that, because the sort of expectation of the December 2023 deal was a co-funding arrangement between the Commonwealth and the states, the Commonwealth sort of put a quantum on the table, and so it's almost like some notion of that's the maximum from them, and so then it's a discussion about the co-contribution from the states. But this is where it does get really integrated with the health, and so obviously it's up to governments and political decision making. But there was a sort of strong expectation of the premiers that that there needed to be a really strong outcome on the health agreement, a Commonwealth contribution to the running of health, and that would facilitate the states also being able to make solid contributions through this disability ecosystem. And so you can imagine that's the conversation that is ongoing. The economic modelling and the detail of that in terms of the quantum that the state can afford to contribute, how that looks, how that phased is will be a significant part of our work. It has certainly been a bit challenging not knowing the timeframes under which we need to do that. We are trying to be good, well-prepared public servants where we do components of that, but we're sort of missing some pieces of the information to fully finalise and get government to the point where that they can make those decisions.
Thank you. Thanks, Chair.
Thank you. Just following on, so moving, I suppose, from looking purely at foundational supports to some of those health checks and things that need to be done regardless of foundational supports. Is the task force looking at some of those things now? Because we have heard some evidence this morning that there's, whether it's regarding the stigma or lack of understanding around health checks, what work's being done to increase the number of young people that are having those checks on a regular basis?
I can speak a little bit to that and can take on notice if you'd like more information, Ms McLaren-Jones. But yes, certainly it's a known phenomenon that the health checks that occur, we have very high rates when it's the first check, when there's a brand new baby, and it's quite a decline over the period of time, getting up to that sort of 4-year-old check. So that is an ongoing area where our Ministry of Health colleagues with their LHDs work as much as they can with their child and maternal health services to get the messages out about the importance of those checks. But a couple of years ago, extra funding flowed to a partnership for the first time between the Ministry of Health and Department of Education on the 4-year-old checks. And so certain individual early childhood education services had been getting allied health or other experts in to run checks or making relationships with their local LHDs, but that was very ad hoc. So we've created more of a programmatic basis of trying to get more and more children getting their 4-year-old checks in the early childhood setting where most children are attending, not all children, but many, many children. And so we are seeing increasing uptake through that, and I can take on notice where that's getting to and how that's flowing out. So, but you're right. There are stigma issues. There are certain communities where we have to be really culturally aware and sensitive about those matters. But we are very conscious that when those checks are done in early childhood settings, it's often a place where families feel really safe and where they have relationships. So we've been really committed to promoting that. So that work is probably adjacent to the work of our task force. But as we say, we do think we have this opportunity to everyone can get frustrated in government sometimes when some accidental silos get created despite good intentions. And so we are really trying to sort of draw out from all of our colleagues in agencies, where are there great pieces of work, where is there data being collected, where are there programs that you're hearing good things about, how do we utilise the public education system where we have some more of the levers, what are all the ways that we can bring this together?
And I suppose that I'm happy for you to take this on notice, but it's that next step, which is what's being done to address some of the concerns, and this came through in for the Cold community, but also in Aboriginal, where there's a stigma around a diagnosis, and what is proactively being done to ensure that that the young person is getting the services they need, and hopefully working in with the family to address that. And I know you won't have those answers.
So, I'll take on notice. We'll take on notice the health and developmental check aspect of it. In terms of the diagnosis, certainly as Ms Campbell has spoken to, there's quite a bit of detail to work through on exactly what this system or concept means, but certainly philosophically, both from the NDIS review and the way we've been conceiving of the work, is how do we do this in a way that is not diagnosis driven, because that is the message loud and clear from every expert and also from all the learnings of the NDIS review. And to be quite frank, we're also talking about young children, so some of these diagnosis decisions that might be appropriately made when a child is 5, 6, 7, 8, 9 may be less appropriate at an earlier age. So we are thinking about how do you appropriately think about important things like eligibility and need, but how do you do that in a way that's more based on functional and educational assessment, those kinds of things, rather than diagnosis.
I might hand over to Ms Boyd.
Thank you. Just a quick question about the TEI recommissioning. I understand that the TEI funding had been extended for 6 months to December 25. So that the TEI could align with the delivery of foundational supports. But now that we won't have foundational supports by this time, is the TEI recommissioning going ahead regardless? Are you able to give an update?
The TEI recommissioning will go ahead regardless on the 1st of January next year. So we will need to be engaging with providers probably August, September this year to get those new funding agreements in place. So because we're not yet clear about the timeframe, so when foundational supports needs to be set up, we're obviously going to need to be a little bit flexible, and that's certainly the communication we've been providing to TEI providers.
And that funding, I guess the funding for, under the TEI program and other programs, will that be treated separately to the foundational supports pool of funding, or will there be some overlap?
I think we need to work through that to look at, so we don't set up, I think some of the problems in not just in New South Wales but other states and territories is we often set up very specific types of programs and with particular eligibility criteria that can be not very flexible at times. So it's really, and what we know about, families or vulnerable people who access our services, they don't just access one or two of those services. So I think we need to really rethink about how we commission services so that they are, child and family centred, and be less, we obviously have programs for good reason in terms of, there might be a specific program that's very evidence-based that has particular parameters in terms of how you deliver those services, but I think it's an opportunity to look at how we can leverage off existing services in the state, but also look at what are the connections between those services so that families have soft referral pathways, those sorts of things, and don't have to go around trying to navigate how do I get into this service or even knowing about a service being available.
I guess the fear is that with foundational supports being, sort of being moved off of NDIS effectively and into the states, that states and territories might just look at a big chunk of what's already being provided by the states and say, well, there's our foundational supports, or not do it to the extent, not fund to the extent we would expect additional services. I guess what level of comfort can be given to people? Will there be transparency over how much is new funding and what is actually coming from the states?
Yeah, we will be transparent around, because we, as I said earlier, we currently provide things that look like foundational supports based on what we understand about it now. So we'll need to identify, where there's existing funding within New South Wales and where there's new funding from the funding envelope that we do get for New South Wales for foundational supports.
And at some point in time, Ms Boyd, there'll have to be some form of federal funding agreement that specifies the Commonwealth and state contributions. Part of the negotiation with the Commonwealth will be what are the requirements for the use of that. There's discussions both through disability officials and they might come up through First Ministers in terms of once these threshold issues about health and disability funding are worked through, there would be consideration given to national standards as well as what quality and safeguarding. So I think there is, and as per usual, it's ensuring that we have an eye to what should be national about this approach, so that there is a level of consistency while really respecting the diversity across not just our state but the whole country. And so I think there's discussions about what could be the principles, what could be the standards, what are the pieces of the architecture that need to remain constant. And one of the reasons why it's absolutely in everyone's interest for that is that we need to have clarity on the referral pathways in and out of the NDIS, or if there's co-conditions. So, for example, it may be that a child has an NDIS package for another form of disability but may be eligible for some other additional general or targeted foundational supports, or it may be that over the time their disability becomes more evident and they are eligible for the NDIS pathway. So all of those kinds of points are going to have to be worked through as well.
And I think in addition to that, the review of the ILC programs, understanding what's going to happen in that particular program, because I think it's 364.5 million over 5 years from 24-25, with an additional 150 million annually from 2029 to 30, and what they're proposing in terms of the categories of support there are individual capacity building, family capacity building, community capacity building, information and advice, and emerging practice and independent evaluation. And what the NDIS review identified was when the scheme was set up, I think they used to call ILC Tier 2, and it didn't really end up doing what it was intended to do because it was very focused on managing participants into the scheme. So you had local area coordinators, and you also had, I think, what are they called? EL?
Yeah, I forget that name.
I can't remember the name, but the early childhood people who actually support children and families. Yeah.
Has there been any... I know you're at the beginning of kind of looking at this, but one of what I would view as a neglected area of early intervention for all children, regardless of whether it's children with a disability or children that are at particular risk of mental illness or trauma or other things because of family circumstances or something that's occurred, is that sort of early childhood space, and done well, the ability for an early childhood a centre to be able to identify and refer and also guide is really sort of strong. But again, we have this unfortunate complexity when you look at state funding versus federal funding in that space as well.
Yes.
Has there been some thought given to how we, I guess, boost that area as a foundational support with state funding?
Yeah. Yes. So many things on that one. So firstly, on the Commonwealth funding side for CCS, childcare subsidy funded services, the Commonwealth before the last election did instigate a review of their funding, their disability funding program. And I think there's actually been quite a great deal of recognition by the government, as well as definitely by stakeholders, that program needs enhancement. So that would certainly be, a position that New South Wales has put to the Commonwealth, that baseline funding and support for childcare subsidy services to be able to include children with disability is really vital. And it also means that there are really quite a significant number of children with disability that attend our community preschools, because there are quite established funding programs through those state services. And certainly, I would say in high quality services that I've been to across the spectrum, you see excellent examples of that practice. And some of them, they have it sort of integrated hub type models even within the facilities, or if not, they've still got professional learning and training where they've embedded those philosophies in the teaching practice of their educators. So that is why when even Ms Campbell was talking about who are the stakeholders we need to have contribute to thinking about foundational supports and how we think about it as connected to general and mainstream and referral pathways, it also includes all of our early childhood education stakeholders and our schools. And as the government's committed to growing the number of public preschools, that is another really strong opportunity for us to get that practice right. So yes, there's real potential there.
Sorry, final question, I hope. Some of that level of, I guess, bolstering foundational supports is not necessarily just funding either. Some of it is regulatory change, or it is a change in legislation even. Is that also part of the kind of work that you're doing and that other states in Australia are doing around what that looks like?
Not directly. I think certainly the legislative conversations have been limited in these forums to the NDIS specific legislation. Yeah.
Interesting. Thank you.
Thank you. Mrs Mitchell?
Thanks, Chair. I've just got one, and I just was interested, I suppose, in terms of those conversations with kind of other states, as I guess everyone grapples with how to implement this. And I suppose for cross-border communities as well, because I would have assumed that things that might have been NDIS funded, if you happen to live in an Albury or a Tweed Heads or whatever, you could, find the service that worked for you. Is that going to be a challenge as you have to move to kind of a bit more state-based delivery, or how will you work in to support families that might straddle those borders?
Yes. It will be another aspect of our federation again. Yeah. And look, I think what's really interesting as we do this work is that you realise that, these are our New South Wales children and families, and they go in and out of, our schools, our early learning, they get some federally funded services. So it's probably just that we're putting the emphasis, or there's a different combination of those things that we have to work through, Ms Mitchell. But certainly, we obviously have existing cross-border MOUs on various issues. So we'll probably at the right time have to be thinking about whether any of those mechanisms are needed, but it will certainly underscore that there will need to be clarity around those pathways between the NDIS and others, and then what you can expect in New South Wales. And we should say we're really conscious both of the opportunity here, but we also think that this is really challenging, difficult work. So we do not want to overpromise straight away, even if there is, a fabulous funding agreement reached between the Commonwealth states soon and some clear deadlines reached. It will have to build up over time, just as the NDIS did, or just any other sort of major social reform. And so that is going to be a real challenge to really sort of set appropriately high expectations for ourselves, for people and their families, but also not be able to switch it, click a button and then we have a fully fledged new set of services. And we did cover some of the workforce constraints before. That is something that we're very conscious is a rate limiting factor on the speed you can do these things. But it's also why it's really critical that our engagement with the Commonwealth is really strong, because we're very conscious that the NDIA has so many allied health professionals working in their ecosystem, and we need to have some really detailed conversations about whether any of their reforms and changes open up the capacity for some of those workers to also contribute to our allied health foundational supports, whether that be on school sites, in early childhood, whether that be in neighbourhood centres. So that's another complexity which will have cross-border implications to work through.
Yeah, thank you. Thank you, Chair. That was the last one from me.
I've only got two more, and one just follows on from that around workforce. And I'm mindful that some of this probably crosses over into the skills and training sort of areas. But what work is being done to, I suppose, look at recruitment, retention in that sector?
So we've undertaken some level of research with academics and ourselves to start unpacking some of those issues, and I think DSS has led consultations on that as well. I think some of the things we're thinking about, Ms McLaren-Jones, is being careful not to over-medicalise the model in the context of both the needs of children, but also it can become increasingly unrealistic if you just don't have the workforces to support. So what is the supports that can be done by caseworkers or other people, and then what are the categories of support that absolutely you need an OT or a speech pathologist or that specialty. So trying to think as we design how we can best utilise our specialist workforces and how we would leverage off what we already have in our health system or some of these conversations, because it is genuinely a workforce challenge there are no simple solutions to.
And my final question is, and it's not relating to foundational supports, but it's the supports in general. So particularly for the for people who are no longer eligible to the NDIS or who are foreseen to be not able to get onto the NDIS with the reforms that have come through. What work is being done to bring those people in to get the state supports that would be required?
I think that's part of the work that we need to look at and understand what the unmet need is and people who aren't accessing mainstream services. So I think it continues to be to work with, the relevant agencies, including DCJ. Obviously, there are often funding constraints that impact on how many services can be delivered, and they're real constraints at the moment. So probably can't give you much more, but happy to take it on notice and come back to you. Unless, Ms White, you had anything to add?
No, I think that we often speak to the Commonwealth about the interactions between those kinds of decision making and then the impacts on state services. So that's an ongoing area of collaboration, but also sometimes we have to put our positions quite strongly on those issues.
That's fine. Any other questions? No. Well, again, thank you very much for coming in today and also all the information and the work that you guys are all doing in this space. It is,
thank you.
As we know, it's quite complex and significant changes and reforms, so it is really appreciated.
Thank you.
Cheers.
Thank you very much.
Thank you.
Thank you.